Thank you. Good morning. Welcome to the Finance Committee meeting. Alderwoman Finlayson, Alderman Payon, and I are in attendance. First order of business is approval of the agenda for today.
Mr. Chair, I'll move approval of the agenda as written.
Any discussion? All in favor signify by saying aye. Aye. The ayes have it. Next item on the agenda is approval of the minutes from the last meeting.
Mr. Chair, I'll move approval of the minutes from the last meeting.
Second.
All in favor signify by saying aye.
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 The ayes have it. Before we get into the heart of the agenda, I was asked by Mitchell Stevenson to poll the Finance Committee about our meetings in May as the council is getting ready to go back in person in May. Apparently, we can save half the cost of each of these broadcasts if we do it from council chamber. And I told her I would get your opinions. It would still be broadcast and streaming, but would require only one person, not two.
So we're talking about starting next Monday, the 3rd.
That's the proposal, yes.
Well, I guess I have a question for Julian. Right now, I have my iPad, my desktop, my binder, and I have the budget book online. How will we have access to all of what we need in council chambers? Or will we? Not how, but will we?
Will you have access to everything in council chambers? I mean, we realistically would just go the way that we were beforehand. So, I mean, you'd have the printouts in front of you. Takia, you might want to chime in too. I'm trying to think of, I mean, your iPads. I mean, you're missing one piece of technology, which is the one that you're on Zoom with currently. But everything else, I think, should be relatively, you should still be able to access.
Are you worried about space, Alderman?
Yeah.
Well, that,
I mean,
yes.
it's not a lot of desk room up there.
No.
If they're back in their regular chairs.
Yeah.
So I and Ellie are lucky because we can spread out onto the mayor's dais, but everybody else, it is tough. I was thinking about that myself, Sheila. And of course, I have my shelf of knowledge up here that I pull down every once in a while. So, but I think Mitchell said that, and maybe Julian, you know this, or Jody, we'd save several $1,000s with each broadcast.
So as of now, I've been charging, moving those costs for the services that relate to COVID. I have been moving those over to CARES Fund, including up through March. I don't know if that entry's been posted yet or not, but those are going to be moved. Yeah, so the only thing that Mitchell's budget has to bear is the regular cost of the contract. And I haven't talked to the city manager yet about whether or not we're going to continue that April, May, and June, moving that money over to CARES.
Yeah, so technically right now, half of a broadcast goes to CARES, the other half stays within the budget. So I guess to Jody's point, I mean, yeah, depending on what happens with the CARES funding though. But yeah, the major difference is that right now, for every one of our meetings, I'm in chambers here with Takia, and then Mark is in the studio making sure that everything is running on that end. So with you coming into in person, then it would just be one of us having to be over there, and we'd be able to manage it then just fine.
So we miss having you with us, but I don't remember, but it sounded like it was several thousands of dollars for each broadcast.
Not for each, no. It's a few hundred per broadcast we'd be saving.
Oh, okay.
Right, Mark?
Well, let me ask Julian, if we're there live in council chambers, and I'm not opposed to that, so let's be clear, though I am confused why Mitchell is saying that this is coming out of her budget when it's coming out of CARES funding. would you still not have to be in council chambers, and wouldn't Mark still have to be across the street?
No, we'll run everything from the cameras. And I mean, I think the concern is that when the CARES funding goes away, I think that's mostly where this concern is.
Yeah.
Is that because I think we're
And
living
I
on
will
borrowed
say,
time, I think, right now, right?
right, the payment starts out in Mitchell's budget and they move it out of her account over somewhere else. So when she's seeing it before I've moved it. Now, I think we've done journal entries to move everything through March, but we had been talking about when we cut that off and Mitchell would have to pick up the rest in her budget. And that's what she's concerned about, is she's going to have to pick it up. And
As
I
well
would
as what
stop
happens-
moving it to CARES.
Sorry, Jody. As well as what happens with boards and commissions, depending on how things go in that direction.
Duan, could you wait one more second while I let David speak, please?
No, he can go ahead. I
Okay.
think we're all going to talk about the same topic. So
All right.
go
Yes,
ahead, Alderman
please.
Gay.
Thanks.
Alderman Gay.
Yeah, I just had 3 quick questions. The first is, would we
Wait a
have...
minute, David, go.
Okay,
It's
just
really
very quickly, I promise, very quickly. So, the whole reason why we did this was not so much the funding aspect, but was to get the council back into chambers again. So we can certainly continue, and we will pay with the CARES money as long as we keep meeting virtual, because that's the only reason we're doing this, is because of COVID. So it's strictly COVID related. But our sense was that the council wanted to come back and start meeting in person again. So we thought that starting at the beginning of May, that all full council meetings, but also all committee meetings would be in person. So that was our thought process going into this, and why we suggested. I'm not sure about the question that Mitchell asked, but that was the sense, was that once we transition back, it would be all committee meetings as well as the full council meetings. Thank you.
I'm sorry, Alderman Gay. I meant to be funny, but
No.
Mr. Gerald took me up. Yes, please go ahead.
Perfectly fine. My 3 questions are, 1, if we could get 2 tables from Parks and Rec, just like regular pop-up tables, and put the tablecloth on them and sit them in the aisles behind us. So at least we could just turn around and have any additional stuff there. The second is, would we have to cut staff, or would somebody be missing a paycheck if we were to start to roll back on? How does that work? And then what was my third point? Oh, my third point was that I don't have the schedule for the May meetings yet, but if we do go to some in-person forum, could we have maybe 2 and the evenings or something it doesn't even have to be evening, maybe afternoon, just so that we who work, we could, make it work?
So the meetings in May are right now scheduled all as deliberations. That doesn't mean that we might not need to call in some help from department heads or other people, but we should be through all of our presentations on the 28th. So the way it's blocked out now, those May meetings are for deliberations. In terms of table, I was thinking of bringing a folding table and putting it beside me. Maybe we have some tables from different Main Street investments that we could bring in. Excuse me.
Yeah,
But-
we can certainly bring in tables if that would help the council members. Absolutely. And as far as laying off a person, it's the contract that we have with Mark and Julian, and trust that they are very busy and are continue to be very busy, because all the board and commission meetings are still going to be done virtually. So they'll still be involved with all of those. So I don't think it's an issue of anybody being laid off.
No, but it is a consideration in that we are expending large amounts of their time. And to the extent that we can give them some off-air time, I have a feeling that might be appreciated. We can go back to a more normal schedule, but I'll let Julian or Mark speak for themselves on that. But we will eventually go back to, I hope, a more normal lifestyle, which is we've always had the finance committee meetings in council chambers, and we've figured out a way to spread out. We'll have to figure that out again. Did I see Sheila? Yes.
Yeah. Yes. First of all, David, Mr. Gerald, did I not hear you say that all committees and commissions would be going back live starting May 1st? Or just
So all
by choice?
council committee meetings will, boards and commissions are not. They're not ready to, and they don't want to yet. So we have concerns about forcing them to, but it will be all council committee meetings.
Okay, thank you. I would like to request a chair or a table beside my desk since I'm on the other end. And Mr. Chair, the difference this time is we have these budgets online, which gives us an additional resource. So I don't know what's going to be on the big screen. I don't know what's going to be on our iPads, but how do we access OpenGov during our deliberations? You're muted, Ross. If you're talking, I see your lips moving.
That's a good question. I was actually thinking that I may need to try to load up OpenGov on my laptop so I could bring it in and flip back and forth. I mean, I think we've been fortunate that we've been armed with a lot more tools than we ever had before. And so we're starting to use them, and we appreciate that, but it does take up space. And I actually learned that my problem with Comcast has been caused because I have my old desktop computer set up next to my current one, and it was what was weakening the signal. So I think that as long as we can get Wi-Fi on our laptops, and Jody, if we can, or Katie, download onto our laptop the OpenGov stuff, which I assume we can just go to that same email you originally sent us in our laptop and download it there.
I don't know that there's anything to download. It's all on the internet. As long as you have access to the internet, you can get to the link. Am I correct, Katie?
Yeah, I think that's what he meant is you can go to that email that I sent you guys and you can access.
Open the link and it should be available. There should be if you're on a new device, you should still be able to get to it as long as you can open up the link in your email.
Alderman Payon.
Just to make it clear, these meetings will not be open to the public. Is that correct?
That is correct, is my understanding. And not only that, when I was talking with Mitchell this morning, neither will our council meetings. We're working on a way that people who want to give testimony to us, and Julian can speak to this better than I, will be able to get on to present to us. I guess, is it still only going to be audible, or will there be visual as well?
Yeah, so right now we're actually going to do some, there's some testing we did this weekend, and we're going to do some run-throughs today. But we'll be using Skype as a way to bring the public in to testify. And then as far as everything else, it'll still be live streamed to both Verizon and Comcast, YouTube, and Facebook for every single meeting, which will meet the Open Meetings Act requirements for public.
Well, may I ask, I received one of the online testimonial forms over the weekend. I'm sure you all received it. And it was checked that he wanted to present live testimony. So does something need to be changed so that residents will realize that they cannot give their testimony during our meeting? Because clearly this gentleman thinks he's coming to speak, I believe, from what I read.
Yeah.
It can be live, but it just won't be in person.
Right. As far as I understand, and I mean, David, maybe you can speak better to this, that we don't typically do live testimony during finance meetings, but
Right.
Yeah, so that's not going to change. So that form that you saw for city council will be the exact same, and that's what we're going to do. We're going to Skype them in, so they'll register. We'll send them a number to basically call in through Skype. Then when we'll go through that queue, and then we'll bring them on. So they'll be actually on one of the monitors here in Chambers. And that won't be until May, though.
Neither one of those requests were from residents.
Oh, I didn't notice that.
I think the one that I saw was from a resident, and I think it was somebody I know. I can't remember, but I'm sure we got more than one. Well, may I request that Julian, you and whomever, Mark, be on hand probably 30 minutes before tomorrow night's meeting
Of course.
to make sure that we have, because my OpenGov is on my desktop, it's not on my iPad, so I'm gonna need help with that.
I will say we are not OpenGov. We don't know how any of that works. So
Okay,
it might be better. I don't know who might be a better person for that one. Well,
Well, I think Katie
but
is
we
the
will
one.
be around to make sure that if any of you guys need help with anything, we'll be around. But
Okay.
that
Alderman
is
Gay.
not our area.
I'm glad there's no fire going because we certainly are keeping Doug and everybody waiting. Alderman Gay.
Yeah, I'm just wrapping it up because, like, as everybody's mentioned, even I operate like this. I have the OpenGov. I can access it on either my iPad or my desktop. You just click the link and it pops right up for you. And so it should be fairly simple for all of us tomorrow night, definitely.
Okay, the operative words should be, but we'll see. All right, are we ready to move into the next portion of the agenda, which is to hear from the fire department, their presentation? If so,
Yes, sir.
Yes.
we need to, let's see, do we have fire? I'm looking. There, yeah, that's Chief Romali, I see, okay. And Deputy
Chief
Chief
Spriggs.
Good, all right.
Good morning.
Good morning, gentlemen.
Morning.
Good morning.
Please, I won't say please fire away. Please proceed.
Okay, I guess Julian has the presentation to bring up. All right, as you all know, that Carol and I are the leaders of the command staff here in the Indianapolis Fire Department, so we can go to the next slide. And the Indianapolis Fire Department exists to provide a safe environment to our community by minimizing the impact of fire and injury through public education, quality services, emergency preparedness, and overall culture of safety. So everything we do, all our core goals, all of our performance measures, and all relate to our mission statement. We can go to the next. As you know, also, we fall under the city manager, and the fire department's broken down into an operations section and administrative section. Next slide. We are an ISO Class 1 department. That is the Insurance Services Office is a independent agency that is does the insurance ratings for the insurance underwriters. So it is Class 1 to Class 10. Class 1 being the very best, Class 10 being very little fire protection or none at all, and we are a Class 1 department. Some of the factors that go into that is our water supply, and as you know, with the water plant, our fire hydrants and all, our water supply in the city of Annapolis is excellent. It also rates our fire apparatus, our ladder truck deployment, our staffing levels, training, the dispatch, which is done through Anne Arundel County, our community risk reduction, which is our prevention programs, and our fire investigation program. So when it goes to our fire department deployment there for the engine and ladder companies, it does take into consideration our mutual aid companies. And our two closest one is the Annapolis Next Station and the West Annapolis Station on Jennifer Road. We remain only one of two Class 1 departments in the state of Maryland, and there's only 45,000 or so in the actual nation. So we're very proud of that rating. Next.
Chief, can I stop you there? Two questions. One, how often are the ISO ratings given?
Carol, you want to answer that one?
Annual or?
Sure. So normally a department or an organization would request ISO to come in and conduct an evaluation. And reevaluations are conducted probably every 5 years, but typically something very unusual has to occur for ISO to come in to do another assessment. And some of those things that could happen to be a major reduction in staff, some major fire loss or loss of life, things that would trigger ISO to come back in and reevaluate to see if the rating needs to be adjusted.
Thank you, Deputy Chief. The other question I had years ago, I remember, and this is the days of John Patmore, where he put some chunks of water main on our desks, and we had a problem with water pressure on Duke of Gloucester Street. Are we up to snuff on all of our water pressures for all of our hydrants across the city? Is that what I understood you to say?
So as far as we know, we are. Public Works maintains the water system. It actually falls under them. They actually go out and service the fire hydrants, which is part of this rating. And they also do flow test on the hydrants. If we run into an issue, Public Works would come out and determine whether or not it's just a valve's partially closed from some work that was done, or if there's an actual issue with the system. But as far as we know, right now, the system is to its maximum capacity.
And as long as we're diverting you, did you get a report from Hook and Ladder Truck 39? I think it was Saturday, trying to squeeze down my street. It was, they had to push mirrors in on everybody's vehicle. It was quite a tight fit.
So that's a good indication, though, of why we have the tiller ladder trucks, those hook and ladders, the way we do. There's only 3 of them in Anne Arundel County. The other one is up in the Revere Beach area, and that's owned by a volunteer company. But Anne Arundel County, they run straight ladder trucks, which means they don't bend in the middle, and they are not conducive to our streets. So that's why our 2 aerials are tiller apparatus. And it's funny you say that. I saw them coming out of the lower end of Eastport the other night. But that is one of the areas, and so is downtown. Narrow streets, made for horse and buggies, and parking on both sides make it a challenge for us.
Okay, sorry for the interruptions. Please proceed with your presentation.
We can go to the next slide. So all the members from the lieutenant rank and below, the uniform members are represented by the International Association of Firefighters Local 1926, which is the union for the firefighters here in the city. And we maintain an excellent working relationship with them. We just wanted to point that out, that relationship is ongoing, and it is a very good relationship, and we work well together. Next slide. So there are 3 volunteer fire companies in the city of Annapolis. It's Eastport, Independent, and Rescue Hose. Rescue Hose and Independent run out of the Taylor Avenue Fire Station in West Annapolis. And as most of you know, the Eastport Station is in the heart of Eastport there. The city owns all the buildings. We have a couple riding members. We don't have a whole lot of riding members, but there are a couple of them out there. But there is a very good support staff. And as the pandemic has come about, the support staff of the volunteer fire company has really stepped up. They are working every week at our vaccination clinics. They were out there assisting us with our Your Life Matters program, which is the opioid prevention or the drug prevention and hands-on CPR. And when I say opioid, it's more than opioid, but it's the Narcan Leave Behind program. And recently, within the last 2 weeks, they were out there assisting us in the Eastport community doing that. Eastport also does a lot of fundraising. They save the city quite a few dollars because they own 2 fire engines, 2 pumpers, a medic unit, 2 gators, which are our special events units. They're also used for any off-road rescues that we need, and they've been deployed multiple times since we've opened up the trails out there at the Waterworks plant. And they also own a pickup truck with a snowplow. Independent's same. They have a pickup truck, a snowplow, and a small rescue boat, and Rescue Hose does not own any apparatus. Next slide. So we'll get into the heart of this. As you know, we have a proposed $21 million budget. That includes our overtime cost. 93% of that is all salaries and benefits. Now, we offset that with EMS billing. So we bring in currently, over the last few years, $1.7 million of funding for EMS billing. So that helps offset that $21 million a little bit. This is our authorized strength that's in the proposed budget and has been in the budget for a few years. It's 136 uniformed people, 6 civilians, and then we have a medical director that we'll talk about in a few minutes. But we operate out of 3.5 stations, and everybody says, how do you have the station? And that's the Annapolis Next station, right there on the city-county line there in the Annapolis Neck Peninsula. So we run out of Eastport, Forest Drive, and Taylor Avenue stations. We staff those stations, and then the Annapolis Next station we share with the county. It's a county-owned station. They pick up the cost for that, but we have 3 people assigned in there, and the majority of the calls out of that station are in the city of Annapolis. We're very proud, and I knock on wood because I don't like talking about this much, but our last civilian fatality from fire was in 2010. And then our last line of duty death of a firefighter was in 1964. We don't want to see those increase at all, so we do our very best to try to avoid those. Next slide.
Can we stay on this slide for a second? And I want to look at your staffing deployment, and I'll ask you about fire, but the contrast with police is really what's in my mind. And police, we have 124 sworn officers in the budget. Here we have 136 for fire. In police, we have a large number, I don't have the numbers handy, but a large number of civilian staff. Is it that there's a lot more administrative and other kinds of technical things that police has to do that you do not have to do? I mean, is it that you're...
Yeah, I'm sorry, I didn't mean to cut you off there.
No, that's okay.
Everything we do is about putting fire engines and ambulances on the street. That's where our staff is. Our staff, and as we go farther into it, you'll see where we have our daily staffing every day because it's in our presentation here. But we have a very small support staff. We're very proud of our support staff because they do a lot for the very few people we have there. But with the uniformed people, we can put them on the street to respond to calls. The police are they have the opposite there. While they need their uniform positions, their crime lab, their reports, there's a lot of areas within the police department that they can use those civilian personnel to do. Where for us, we need to, when it comes to a fire or a medical call, we need a number of people on the street. And I think that's why you see the big difference there. But overall, I believe they have like 30 some support staff. So they still have a larger department, but we do compare to them, I would believe, when you're looking at it.
Okay, thank you for that. I mean, it is an interesting contrast, but I think you've explained for the fire side of it why it looks the way it does. So thank you for that.
Mr. Chair, I have a question regarding that. Could you, Chief, explain the civilian and then the medical director? Is the medical director contract or are they an actual employee of the city?
So the medical director, I can't even say it this morning, is a contract employee. Actually, if we go a little farther into the presentation, it'll explain it more. So okay. I'll explain him when we get to it because it explains our EMS division. But our civilian employees are also, they're covered farther in. If we go a little farther, I think it'll answer that question.
Okay, thank you.
We'll go to the next slide, please.
Mr. Chair.
No, I'm sorry. Yes, Alderman Savage. Welcome aboard.
Thank you. Chief, I just wanted to ask another question about the staff. I didn't quite understand everything you were saying, but it sounded like 142 you have total positions, but I'm trying to bring up the presentation I took a look at earlier. But from what I recall, each of the fire stations kind of, I think it was about 12 employees each. So 12 employees at two of the fire stations at one time, at one shift, I guess. And then you had a couple employees at the shared station. But I'm just trying to correlate. Like, I don't know how many shifts you have, because that's, on the surface, it looks like you only have about 30, 24, maybe 30 employees on one shift. That's just much smaller number than this 142 you have here. So I'm just trying to get a better understanding of how that breaks down.
So I do believe, and we can do this either way you want, but I believe as we move farther in the presentation, it'll explain it a lot more. I mean, we can go into it now, but it will be covered in the upcoming slides with the staffing in the stations, and we can talk about the number of shifts.
That's fine.
Want to do it.
That's fine. Thank you.
We're just eager to know what you're doing, so we're jumping ahead.
I'm with you, and we have nothing to hide. We have nothing to hide at all. We are here to answer any questions you have.
Mr. Chair, may I ask that we allow the chief to finish his presentation before questions?
You can certainly ask that, but you know us. But
I would hope that we would all give the chief that respect. That's all.
I agree. Please proceed, Chief, and we'll
highlight what's on the slides. We'll work our way through it pretty quick because I know there's going to be a lot of questions, and then we can go back to it if that probably helps. So if we could go to the next slide. These are just some of the services that we provide, but emergency medical services is 70% of what we do. That's a majority of our calls. But everything else in here is done within our department: fire rescue, hazmat, technical rescue, marine operations, swift water, explosive services, fire arson investigations, code enforcement, and so on. And this is just a few of them, because it doesn't even go into our public education programs with Your Life Matters, the safe stations. But we just wanted to highlight a lot of what our people are doing. And this is all done by that uniformed staff to wear these multiple hats. So, and that's what makes us so great, is because the people that we have here that can do that. Next slide. So these next 5 slides will go through our staffing levels. But as the alderman brought up, what we have to consider is we have a 4-shift system and then day workers. So there's 5 platoons all together. They work a 24/72 shift. And that goes in correlation with some of the questions I think that have been brought up about why the fire department has grown over the last 21 years. I know there were some comparisons to back in 2000. What I can tell you, in 2000, we ran 4,000 calls a year. In 2021 and 2020, we run over 12,000 calls a year. Also, over that period, in that 10 years from 2000 to 2010, you'll see an increase in staffing. Now, we've added medic units because of the call volume. We also ran 2 people in fire apparatus, which is not a safe thing to do. The national recommendation is to run 4 people in fire apparatus. And as you see, as we go through this, we run a 3-person suppression company. I would be lying to you if I didn't tell you that we wouldn't like to have 4 people. Obviously, 4 people is better all around. There's studies that show it, but our 3-person suppression crews work well for us. But we are on a 4-platoon system. Over that period of time, between 2000 and 2010, we actually added a 4th shift. And the shift was added because the mayor and council entered into an agreement with the firefighters union to reduce the work hours of our firefighters. Our firefighters were working a 56-hour work week. All the jurisdictions around us, and you can compare us to small jurisdictions and big jurisdictions, they were going and reducing their work weeks to a 42-hour work week. So the city agreed to do that. They knew that it was going to be cumbersome for the city. But when we hired that 3rd shift, we had to hire 30-some people, or the 4th shift, we had to hire 30-some people, and that included chief officers, captains, lieutenants, down to firefighters. So I think it was in 2005, we had 30 people assigned to each platoon. In 2021, we have 30 people assigned to each platoon. And as we go through this is our daily staffing. Remember, you got to times it by 4 for the 4 platoons, but there's also, this is what we need to staff every day. So beyond that, our 25 or 26 people with the investigator, there's 5 other positions, and that's to allow 4 people to be on annual leave, and that leaves 1 sick leave, educational leave spot, or any other long-term illness. So that's where the 5 people, if you try to compare it to the budget book, if you add up these numbers, that's where the difference is. But there's 30 people assigned to the shift. So this is the Forest Drive station. As we run a chief every day. It's a battalion chief's running that building. So there's 1 person there. The engine company has 3 people. The medic unit has 2. And then we have 1 fire and explosive investigator. So there's 4 of them. So there's basically 1 assigned for each of the shifts. They run over or just under 6,000 calls out of the station last year. And that's our numbers. But it's the busiest engine company and medic company in the city are run out of this station here at Forest Drive. We go to the next slide. It's the Eastport Station.
If I could risk incurring the ire of Alderwoman Finlayson, you gave us some very, very important historical background information, and I think it speaks to a lot of the questions that I've heard from colleagues and have raised myself over time. Is there, I looked ahead, I've zoomed through the slides, I don't see that history. So is there a way that we could document recounting that history? I think it would be valuable to memorialize, and we can put it in our Finance Committee report to the council, because that was very good information. Alderwoman Finlayson and I lived through a lot of that, but a lot of council members weren't here then, and I think they need to know that history. So it would be very helpful if you could do that for us.
Sure, we'll put that together for you.
Thank you.
Julian, if we go to the Eastport. So the Eastport station, there's 8 people in this station. There's 3 on the engine. There's 3 on the hook and ladder that the alderman was talking about earlier. Actually, the Eastport hook and ladder was on a structure fire in the Annapolis Neck Peninsula when you saw the hook and ladder from the Taylor Avenue station in the lower end of Eastport. But there's 3 people assigned to that, and there's 2 people assigned to the medic unit. So the engine company over there, they cross-staff the fireboat. So depending on what call comes first, that's what they take. And then the ladder truck there, they cross-staff our peak time medic unit, and they also cross-staff the bariatric medic unit. And you may ask what a bariatric medic unit is. And that is for some of our larger people in society that sometimes get ill that we need to pick up. Anybody that's over 300 pounds to 500 pounds, we actually have a unit that has larger stretcher, has a lift system, and it's actually more comfortable for that patient, as well as assisting us with transporting these people, is that we're able to do it because the standard litters that are cots that we have in medic units, they get if you're a larger person, it's very uncomfortable and to have to ride on that to the hospital. So that bariatric unit is available to us in the city. We do have several patients in some of our nursing facilities in Eastport and several patients in the city that require that bariatric unit. But for that unit to go, it's got to come from the staffing of the station. But if you look at the calls below, that just under 5,000 or 4,900 calls, that staff of 8, they run all those units out of that station. We talked about the fireboat. The fireboat's in the lower end of Eastport there. The Gators are special events units. So they're used for every race we have in the city. They're used for events at the stadium. They're also used for anything off-road. And like I mentioned earlier, they've responded multiple times since we've opened up all the parks at the Waterworks Park. They've been to Quiet Waters Park, and they've been to some other parks farther out in the county too to assist with those. So those units are there. That Medic 36 Bravo is that peak time medic unit where when the medic units are all out on calls, we can put that in service with that truck crew. Next slide. It's very similar here. The Eastport station is our Marine Ops station, and the Taylor Avenue station is our Special Operations station. So they basically handle, and they just wear multiple different hats. So the people at this station handle hazmat, rescue, swift water, confined space, all out of that station. They have the same staffing as the Eastport station. It's 3 on the engine, 3 on the truck, 2 on the medic. The engine company cross-staffs the rescue squad. The truck cross-staffs the technical rescue unit and the small boat that we have. There was times when we go back to the historic view of the department where we lost those people in 2010 and it was supposed to be short time. And I know we got the SAFER grant and added back to it, but there were several times during that it became very challenging. We actually used to cross-staff the medic unit at Eastport, but because of the call volume for medics, we can't do that anymore. So the medic units have to stay fully staffed every day. We can't cross-staff those units anymore. But out of the 5,000 calls they run out of this station, everything below there, that's the 8 people assigned to those stations. They respond on all that apparatus on the bottom of the screen here for those calls, and they handle first call at first. So if it's a water rescue, we're going to handle the water rescue. If it's a utility line down, then we're going to handle the utility line down. If it's a medical call, so they're going to take whatever piece of equipment out of that station that's needed at the time. This next slide is the Annapolis Next station. This is the Anne Arundel County Station 8, and we call it Annapolis Station 48. It is owned solely by Anne Arundel County. We provide people in that station. So we run the medic unit and the EMS supervisor, which is also crosses over as our safety officer on call, because for every major incident, you have to have a safety officer. So our EMS supervisor is also cross-trained as a safety officer for primary calls. So out of that station, you can see that medic unit ran 1,900 calls and the EMS officer ran 1,700 calls. So out of all those slides, I always get the questions about, well, do we really need a fire station in Eastport if the Annapolis Next station's here? Well, you see these calls here. This is the 3,000 calls that city units ran out of the station. The engine company that's in that station, they have a pumper tanker that's staffed with 3 people, and they cross-staff the dive unit, which we have members on the dive team also. But they cross-staffed that, and those units ran 2,000. So this station alone ran close to 5,000 calls last year. So if we were to come up with that question, what happens if we close the Eastport station? Well, somebody has to pick up those 5,000 calls. And if you see all 4 of these stations, they're all steady, they're all busy. So if we were to reduce any of those calls, somebody else has to pick them up, which means then somebody else has to pick up the calls that the other station was handling. So it just has that whole effect that comes down the line. I just wanted to bring that out to you. The next slide we go to is our day shift. I know Alderman Gay was asking about our support staff and civilians, so we'll cover that here. But it's the chief and the deputy, Chief Spriggs. Our EMS chief and safety chief is a day work position, and that is, like I said, 70-some to 80-some% of what, or 70, 75% of what we do. And safety is our #1 goal, so that position is very important. We have an operations battalion chief who's in charge of the technical services and special services, or special operations units. They all report to him or her, and then that's also our planning chief. So the EMS captain here is an administrative captain, handles our EMS billing, handles stuff with the pandemic. That is one person who coordinates all of our reports. All our reports have to be QA'd and QI'd, which means we have a quality assurance program. Everything has to be looked at under a medical program. 2 of these people here are our training division. We have a 2-person training division that mandates and governs all the, they don't mandate it, but they govern all the training and support all the training that we do within our department, which is governed by not only OSHA laws and NFPA requirements, but also our ISO ratings. So it's a 2-person training division, and they are also safety officers. So they dub as safety officers too. So the civilian people that were asked about, that's our fire administration specialist, who is my assistant. That's Jeannie Coughlin, and most of you know Jeannie. She is very detailed and does a lot for the department here. We have a support analyst and an office associate 3 that works here in fire headquarters here at Forest Drive. So there's 3 of our support staff there. And then the fire marshal's office there is, they work out of Gorman Street. They're down there with planning and zoning to help with that one-stop shop for the permit process. So there's a captain and a lieutenant in there. They're the 2 supervisors. And several years ago, we had a PIO position within the department. Their whole job was PIO and public education. We lost that position. We've done some rearranging here where this captain and lieutenant are our primary public information officers. Captain Zapato, he's bilingual, so we're able to give our educational programs and our public information stuff through him. And then Kenny White, most of you know Lieutenant White. He is our public educator. He does public information, and then he also does a lot of our Facebook and Twitter accounts and any of those other social media accounts that are out there when he can. The 2 fire inspectors they're 2 of the civilian staff that the alderman was asking about. Those 2 are civilian fire inspectors. That's all they do is fire safety inspections. We have an office associate 4 there. And then we have a fire protection engineer. And this is currently a contract position out of contract services. Back in the first 1990, whatever year it was, 98, 90 something, the first Main Street fire, the mayor and council had a commission put together about fire safety in the city of Annapolis. And one of their recommendations was to hire a fire protection engineer in the city of Annapolis. So over the years, we've done several different ways to do it. We've had part-time positions. We've had third-party contractors. We've let the contractors provide us stuff from fire protection engineers. It's been very costly. We know that there's always questions about the historic district, and codes are very complicated, and you have to find ways in the code to balance that public safety and then also what they're trying to do with some of the buildings in that area. So our goal is to hire a fire protection engineer full-time. Now, I've listened to you all on the council and the finance committee many times saying that no matter what we do, we got to do it within budget. I have a way to do that within budget, and we're in the process of trying to do it now. So that's why you don't necessarily see it written in the budget proposed to you, because we're working through this now, but I'm in the process of trying to convert, as much as it pains me to do this, convert a firefighter position to get another engineer downtown to work on some of these plans reviews. I've talked to Dr. Nash. She also agrees that a full-time fire protection engineer on staff can do nothing but help our permit process here in the city of Annapolis. I hear a lot, and I'm sure you do too, from some of the contractors, some of the people saying that sometimes the city is very hard to deal with when it comes to their businesses or any construction they're trying to do. And I truly believe having this engineer on staff is going to benefit that program for everybody involved. Our current contract person, we're paying out of contract services. They're being used a lot for some of the public works stuff that's being done now. They have just a lot of questions there. They had a lot of questions when it came to the pool. So this person is very important to us. It's something that's high on my priority list, and we're attempting to do that. So you'll see that in the near future, but we will be doing it within budget. We're not asking to increase a position. We would just be moving some things around. And actually, there might be a cost savings by us doing it this way. I might be able to come up with, it's not a very big cost savings, but I'll be able to come up with a little bit of funding for you from our contract services that could be used to do something different. It's gotten through the Civil Service Board. The job description has been approved. So maybe David can tell us more, the city manager can tell us more where the next step is in the process. But we are currently working on that. I know that there was some thoughts about some sprinkler legislation for downtown. This position it's going to be needed either way, but it is a highly needed position. It's been brought up multiple times after several different committees have looked at some of the major fires we've had, and we think it's going to be a benefit to the city. So I will take questions on that if you want, Chair, because I know that's...
Mr. Chair.
Please.
Yeah, I have a question about the slide I've been dying to ask as I'm sitting here just going over the titles and looking at the budget book. And so, Chief, I mean this in the most respectful way, more of trying to learn about the operations of the department. But when I'm looking at some of this, and even some of the roles on the screen, are some of the roles a bit redundant? And that one person could do it, it would be a lot of work. But for the size of this city, it would probably suffice. You know, if in particular, well, I don't want to point out particulars because I don't know the people and I don't want the people to feel that I'm attacking them. But there are just some roles here that I see where it's like, you know, captain, lieutenant, and I'm thinking maybe that could just be under one person. And also I'm seeing that, well, I'll ask my second question after you answer that one.
So each one of those are one position, and they are all wearing multiple hats now when it comes to that, but they are supervisor positions. So like the captain and lieutenant in the training division, we need a two-person training division. There's no doubt about that. We need those two training officers because they're actually instructors that go out here and do the training, facilitate the training. The training that we receive through Maryland Fire Rescue Institute, you have to have certified instructors to do that. I am a firm believer that they need to be supervisors. These two positions need to be supervisors so that when they go out in the field and they're addressing other supervisors, that it's not a firefighter instructor that's, you know, getting questioned by a lieutenant from the field about why we're doing something this way. So that those positions are there. But they're also, like I said, they also do safety officers positions. They do multiple things for us. So they're already wearing multiple hats. So each one of these positions are, yes, and they're taxed. They are taxed. All the positions are taxed. And I can tell you with the pandemic, the people in the field are extremely taxed, especially our medics and the firefighters that are out there every day. It's very cumbersome on them of what we're doing. But to answer your question is, they're already wearing multiple different hats. Now, I can understand where you're coming from because you see the battalion chief levels. They are the higher level paid positions within our department. That is true. And there's 6 battalion chiefs. And there's the 2 of them are on day work here. So, I mean, I understand, and they are high paid positions.
I just have 2 other questions, Mr. Chair. You mentioned it's all about the staffing. You mentioned the deal that was made with the unions and the negotiation then as it related to picking up an additional shift. My first is, would you be able to provide some research as to local jurisdictions our size and the staffing levels, or maybe just if it would be helpful to me if you could, show us a jurisdiction our size that operates this way, to this capacity, and that faces, these financial constraints that we face with the fire department. Because when I look at it, and I've had this conversation with you multiple times, 93% of the budget is salary. You're operating with almost less than $1 million of operating funds. Like, how can we help if you need all of these roles? We can't cut any hours. You can't, it's almost as if we have our hands tied behind our back and we have to watch as the budget balloons every year. So how can we assist? Does something have to be renegotiated? What can we do?
So the negotiations on the shift would be very hard because there's all the jurisdictions around us, whether it's our size or not, are working a 42 to 44 hour work week. Some of them work 24, 48 hours, but then they get Kelly days. So when you add a Kelly day to it, the Kelly day is another day off that's built into their schedule. So you still have to have people to cover those shifts, to cover those. So that's actually almost that fourth shift has to cover the Kelly days. So no matter how it goes, you still need the same amount of personnel there. We were on a 56-hour work week, and it's down to a 42-hour work week now. There is a lot of studies out there on sleep deprivation and the different shifts that are there. Like our counterparts at the Naval Academy, they work a 48-hour shift. They work 48 hours in the firehouse, and then they're off for 3 days. But for our call volume, that is not a shift that I would want to look at. And it boils down to is, you're right. If you want to or need to make cuts in the fire department, we need to sit down and figure out how we're going to do it, because it's got to be personnel. And to do that, it's going to reduce services somewhere. We talked about, there's always the thought about closing the fire station. Well, I showed you in there that somebody's got to pick up those 5,000 calls. And then it comes down to which station is it, because that is a political decision that all of us would have to make. Because we always hear about, well, maybe we should just close the Eastport station because the Annapolis Next station's there. But that affects 4 of your wards. That affects Main Street, because they are the primary units to respond to Main Street in the historic district. They are the primary units that respond to the lower end of Eastport. They're the primary units to respond to President Street and Hilltop Lane. And they're the primary units all the way out to the SPCA. So, that affects 4 of your wards there, that one fire station. And all of them are running basically the same amount of calls. So as we get into it, like a structure fire, when we get a structure fire, whether it's in the city of Annapolis, or if it's in Anne Arundel County, or if it's at the Naval Academy, we have to run 5 engine companies, 2 ladder companies, a rescue squad, a medic unit, and a battalion chief. Well, our whole shift is deleted by that. We don't have enough people to run a structure fire in the city of Annapolis. As for, we can look at some comparisons, but I think that the HR director and probably some of the other people in the council can tell you when it comes to the fire department, apples to apples is going to be hard to do, because we are a historic city. You can't compare us to some jurisdictions that aren't a historic city, that's got horse and buggy streets, the buildings are right on top of each other. When you live out in the country, the houses are farther apart. So sometimes your response times can be a little longer because it's not going to catch other things on fire and stuff like that. So it's that slippery slope that we have to look at. But I can tell you now, like I said, in 2005, we had 30 people assigned to the shift. And today we have 30 people assigned to the shift. So it's a hard discussion, but it is. It's all salaries and benefits for us. Then we'll go into like 2 slides down here. It'll show you that after we take out the salaries, benefits, and fleet services money, that we're down to $900,000 to operate. And that's we do a good job with that amount of money to operate for a year, because we can go out here and find a volunteer fire company that only has 1 station, and their operating budget that does not include operational costs is well over $1 million just for 1 station. So I can tell you that the city gets the best bang of the buck. I can tell you that as the fire chief here, and I can tell you that as a taxpayer because I know what goes on around us. But I also understand that it's expensive. We're that insurance policy nobody wants to pay for, but when you need it, you need it, and everybody's glad to have it. And I think that as you move along, and I'd be surprised if you tell me something different, but we don't get a lot of complaints, and I don't think you get a lot of complaints about the fire department. The fire department response times are excellent. The community itself think very highly of the fire department, and unfortunately, it does cost because, like I said, it's an insurance policy nobody wants to pay for. But when you need us, you need us.
Yeah, I appreciate that response. I really do. I love fire. Like you said, I don't think anybody complains about the fire department. So thank you for the work that you do. I just am trying to ask the questions. That's all. Thank you so much.
I'm good. Thanks.
Chief, you might, I don't know if you're prepared to do this, but you might just want to describe the number of units that showed up to the fire at the Watergate apartment building the other day.
So we've had 2 working fires in the city of Annapolis over the last week. One of them was on Gemini Drive, which was a townhouse fire. So for a first alarm structure fire, whether it's that townhouse or it's that apartment building in Watergate, it is just that. You get 5 engine companies, so 5 of the pumpers, 2 of those big ladder trucks, a rescue squad, a medic unit, a battalion chief. Actually, it's 2 battalion chiefs because that's where the standards have gone. So we run 2 battalion chiefs on that. So you get our battalion chief, and if one of our day work battalion chiefs isn't around, you're going to get a county battalion chief on that call, and then you'll get a safety officer. So with that, it's, and Carol, correct me if I'm wrong, but we need at least 25 people on the structure fire. Now, the other day, we had the fire in Watergate. It was during the day, which helps us because a lot of people aren't home during the day. But when they arrived, they had fire coming out of the back of that building. It's a 6-story building that does not have sprinklers in it. And fire was burning up the building from the back of it on the water side. So we had people in the building that had to be evacuated because there are multiple apartments in there. So you got to send different crews in there to evacuate those people. So that first alarm I told you about, we doubled it on that call. We actually had a citizen that sent a letter saying that they saw these fire engines and thought that it was outrageous we did that. But that's what we need. That's the response we need. And for that building there, that was a very good response. So we had over 60-some firefighters from Annapolis, Anne Arundel County, and the Naval Academy at that call. And you'll see Naval Academy Fire Department and Anne Arundel County Fire Apparatus in the city of Annapolis every day. And it's because of our mutual aid agreements that we have. We work together, and we actually send the closest units now. We send the closest units there. So if Navy's the closest unit to the call, and they're riding down, they're on Main Street, and the call comes out in the city, we're going to send them to that call because we want to get somebody there very quick. But it has that effect. While they're on our call, then somebody's got to handle their call. But we do. We all handle the first call first, and as we put all those people in calls, then we bump units up. So we'll have people from Queen Anne's County, Calvert County come up. They'll come fill our stations and move on. So we have a good working relationship with all our surrounding jurisdictions, and we know how to handle it and bring resources in so that we're available for that next call as it comes up.
If I could just add, we are a city of older buildings, and Watergate is well beyond its engineering life. It didn't have a lot of the building standards that we have now, so there's not good separation between the units. We had a problem when they were cleaning the units that toxic smells were just passing from one unit to the next. So I think it's a building that when there's a fire there, we need to take extra care because it isn't up to today's standards. So I certainly appreciated the quick response there, and also the call from you, Chief, letting me know that there was an incident going on there. These are tough questions. We're trying to figure out how to deal with a city budget that is large and is growing, and we look for ways that we can figure out a way to slow down the growth. But I would say that public safety is kind of a third rail that we don't want to touch very often. There are places I think that we can find some economies, but it is hard, and I do get pushback from my constituents a lot about what are we talking about closing the Eastport fire station? Close somebody else's fire station. Don't close our fire station. So, I think it's going to be a very hot topic, and it'll be a topic tomorrow night at our evening meeting. But anyway, we've let you ask us questions. Why don't we finish the presentation at this point?
Mr. Chair?
Yes, Alderman Payon.
Chief, how many firefighters are on the active roster at present? I know you're budgeted for 136. How many vacancies, if any, do you have right now? And how long do vacancies usually stay open?
So we have 3 current vacancies. One of those current vacancies is what we want to transfer over to pay for that fire protection engineer. But we have 3 vacancies currently. The issue that we run into is anytime we get to about 5, it's time for us to start making sure we get people hired. Any vacancy hurts us. We have attrition that's built into our budget already, so we have to make that up. So we can't fill vacancies right off the bat, even if we wanted to. The city manager and finance director aren't going to allow us to, because we would be over budget at that point. But our attrition rate, once we've met that, we have to try to fill the positions. Our problems that we run into is, and some of it will go farther when we get into the presentation, is the number of ALS providers, the number of medics we have. The people that have been leaving are medics. We have a goal of putting 12 medics on every crew. We're down to about 8 on every crew currently. I need 4, 5, I need 6 working every day at the very minimum. So that allows for 2 medics to be off, or we got to pay overtime. So that becomes a problem for us. But the other issue is it depends on when a fire school is, whether we have to run our own fire school or not. But it takes 6 months for us to get somebody out on the street. So when we hire, when we have the vacancies, we're going that long without the vacancies. And then when we do hire, it's going to be 4 to 6 months before we put them on the street.
Okay. Is the 5 vacancies, I mean, is that pretty normal, pretty standard for the department, or does that just happen to be right now?
It just happens to be right now, but 1 or 2 vacancies throughout the year. We have 3 currently. It's not 5, it's 3. But what I was saying is when we get to 5, we have to really consider about to affect our staffing.
All right. Thank you, sir. That's all. That's all from me.
All right, next slide. So this is the responses for the year for 2020. It actually was down because of COVID, and that was a national trend. We typically, the 3 years prior to this, we've run over 12,000 calls, but we ran 11,500 and some. What we did find during this pandemic is the medical calls we were running, we ran a lot more priority calls because people didn't want to go to the hospital. And when they were calling, they needed help and they needed to be transported to the hospital. So we got a lot of that. But as I talked about earlier, 70-some% of what we do is all EMS. There's our fire-related responses, our hazmat responses, our service calls, and that. Next slide. Highlights for the year: we transported over 5,000 people to the hospital. We talked about how this $1.7 million we're bringing in, which helps offset our $21 million budget a little bit. What the finance director doesn't know and the city manager doesn't know, they do know we've been working with Medicare to try to do something about that, because Medicare pays you a very small premium when it comes time to transport people to the hospital. So we're charging we charged for $700 for an ALS call, and we might be getting $100 and some from Medicare for that. And that's a standard, that's a deduction, that's the medical health program that's out there. But we've worked hard over the last year, working with the state, with MIMS, to get the program together that we can actually, at the end of the year, submit a second bill to Medicare for one-time costs, for actual costs. So our prediction, which isn't built into the current, and Jody might want to strangle me for this, but we do believe that our EMS billing fees for next year will be over $2 million. So we'll be increasing that sum, just so you're aware. We did over 33,000 hours of training last year. We had more than $2 million worth of fire loss in the city, and we already talked about not having any fire deaths. And I'm knocking on wood once again. Next slide. turnout times, and it comes to our staffing levels and some of the other areas we talked about that we're very good, and we are meeting the national standard with that. So turnout time is from the time the call is dispatched to the time our people get on the fire apparatus on the medic units. It averages 1.5 minutes. The national standard for a medical call is just around 1 minute, and for a fire call is just under 2 minutes or 1.5 minutes, Carol? Which one?
Right around 1.5 minutes, Chief.
Yeah, 1.5 minutes. So we're very proud of that turnout time. You got to look at that. While we would like to meet that 1 minute out the door, we want to do it safely. We want to make sure our people know where they're going. They're getting on the apparatus. They're not slipping, tripping, that type of thing. But once we're hit our buttons, we're on the fire apparatus or on the medic unit, we're typically, the average response in the city of Annapolis is 3 minutes and 12 seconds after the time we leave the building. The national response, or the goal is 4 minutes, so we are there. The average for ALS, and that's a paramedic, for a paramedic to be on the scene of a call, we have somebody there within 4 minutes. It helps us that a lot of our medics have gotten promoted. They're supervisors on fire engines, so some of the fire engines have people that were medics on a regular basis and now are supervisors on the fire apparatus. But the national average on that is higher. So we are meeting that goal. And the first alarm, having the first alarm assignment on call, that's supposed to be within 8 minutes. We're getting 15 people to call the structure fire within the average of 6 minutes. So we're meeting those goals, and we're meeting those goals because of our staffing levels. And because of those staffing levels we have, we can be very aggressive and make sure the fire doesn't extend beyond the structure of origin in some of our areas where houses are built on top of each other. So we are proud of that. Next slide.
I have a quick question, Chief. When you say that the medics that are arriving with the company are usually in a supervisory role, and you said that they've also been promoted, so every time you promote someone, do you have to bring in a new medic to replace or to take over the duties that they were formerly doing?
Yes.
Or even though they're promoted, they still do the same?
So it depends on where the promotion is at the time. But if they come up and they're the top of the list, or they're within the top 3 and they're picked to make that supervisory position, that means somebody's left the department that was a supervisor. So yes, and ideally we would have to hire a medic to replace them. It's just that whole correlation, when somebody leaves, somebody moves up, you bump somebody up and somebody has to take their spot.
Do you need a supervisor on the medical responses or the, I think you were saying that when you were saying there's the ALS on scene?
The medic units themselves are firefighter paramedics. We have an EMS supervisor, so we have a lieutenant that's the EMS supervisor for the shift that runs the chase car, and they're the safety officer also. So they are the supervisor that's an ALS provider. As for the other ones, what I'm saying is some of the lieutenants and captains that are out there on fire suppression pieces, and actually some of the drivers were medics. So we can get a medic to the scene relatively quickly, and that's why we're meeting that average. But once they get promoted to lieutenant, they don't get their paramedic premium anymore because they're now a lieutenant. So they're not being paid to be a paramedic anymore. However, we do an excellent job of having them maintain that certification, and it helps us because just a simple cardiac arrest call, we need 6 people on that. So I get questions all the time about why is there a fire engine with a medic unit on a call? Well, because of a cardiac arrest, or somebody's not breathing, or heart's not beating, we need 6 people because we have to do CPR, we have to administer drugs, we have to do an airway, we have to do all these functions. So you need a minimum of 6. So I showed you the staffing levels earlier. You get a fire engine, got 3 people on it, medic unit's got 2, and you get the EMS supervisor. Well, there's your 6 people right there. We run into it with overdoses. You get that same response on an overdose, but what we're finding sometimes with these overdoses, more and more, that we have 2 people that are overdosed. So you almost have to double that amount of people for that call at that point. So having the ALS people on the engine companies just helps us because what we call is a ALS tube call is a cardiac arrest or something that's important. You have to have at least 2 people that are the paramedic level certification there. So by having that lieutenant that was a paramedic, I don't have to bring a second paramedic unit to call. They can do it with the resources that are on scene. I hope that answered your question.
You're helping me.
I'm glad you do that.
We're glad we do it too. We're glad when we have people that can walk away from it. Next slide, please. So just some more highlights of the year. Tactical medics, the Fire and Explosive Services unit, that's our numbers. We did 122 safe stations. The tactical medics, they're just medics that help when the police department have a tactical activation. So we know we have medical support on staff for not only the police officers there, but the citizens that are there. So that if anything were to occur, we had somebody there relatively quick and they're already on site. This is a misnomer here because it says our public education programs were suspended due to COVID. They were very limited due to COVID, but with those public education programs are the Your Life Matters, the hands-only CPR, the Narcan. We've continued to do that, but because of the social distancing and some of the other constraints we've had, our public education events for the year were really down, so we didn't track those. And then the Fire Marshal's Office, this is the plans reviews they did last year, which were 540. Next slide. So you were asking earlier about the medical director. It's required under COMAR, which is state law, that our medics and our EMTs work under a medical director. I'm here to tell you we got the best game in town because we have a medical director that charges us $20,000 a year. We work under his license, and it works very well for the city of Annapolis and saving us a lot of money. If we have to bring in a full-time medical director here, you're talking about one of those battalion chief salaries, probably higher than the battalion chief salary because you would have to have a medical director on staff, which is paid a lot more. So we get the best bang for our buck here. He oversees, he's actually the doctor at Anne Arundel Medical Center. He oversees our EMS program. That's where our EMS chief and captain deal with them on a regular basis. They also, if we had any protocol violations or any concerns that would be brought up, but even our advanced airways that we do, it all works through his program or through his license there. So it is required by law to have that. We do have it. It's at a very minimal cost for the city, and it's worked well for us. And we hope to be able to continue that for some time. And then the state medical director is Dr. Chismar. We just threw that in there. So that's the state medical director. Next slide. I feel like I'm really dragging on here. If you want, I'll just highlight our goals. Our goals are the performance measures. They'll be, added to the book. We report them every quarter now, which I would imagine is coming to you in those monthly reports. But our number one goal is firefighter safety, and that's just to enhance the safety of all our personnel. When Chief Spriggs and I took over, that was our primary goal, continues to be our primary goal. And truthfully, if our people aren't safe, we can't get the calls, we can't help other people. So that remains out there. We've got a goal too.
Chief, on this goal, cancer has been a big concern amongst firefighters. Can you tell us how we're doing on that?
So that's probably goal 3 or 4. But
oh,
yeah.
Sorry.
And now you're good. You're good. Well, we can talk about that real quick. So we have some cancer initiative programs out there. Unfortunately, just after I took over as chief, we lost a lieutenant, a very young lieutenant to cancer. It was determined to be something that he had gotten throughout his career, or at least under the claim in workers' comp. It was ruled that there was cancer related to what he was doing here. We've also lost some other firefighters over the years at a younger age that have gotten cancer. Cancer is a big concern in the fire service. And we do everything we can to reduce that. When we go to fire scenes now, that's some of the things we have about the number of people there. We send people to rehab. So we make sure that they get to rehab. We take their vitals and we put them on a cardiac monitor, make sure that their pulse and all's down there and that they're doing fine. But we also make them decon all their turnout gear so that any contaminants that they receive from the fire is off of their gear. Now, we as a city can't afford to give everybody 2 sets of turnout gear. It's just not cost effective for us with our budget constraints. So what we do have is we have an abundance, not an abundance, but we have a cadre of turnout gear in our logistics office so that when the turnout gear needs to be washed after an incident, they can go to logistics and get a loaner set of gear. Now, we put extractors in the stations, which are very large wash machines that extract chemicals out of out of that. So that was one of the projects that you all helped fund in the previous budget. And we've got that in every station. So we're able to do that in each station. They have dryers for their gear. We have requirements for them to decon on site. We have requirements for them not to bring the stuff back into stations with the showers and stuff like that. We've done some cancer initiatives with the exhaust systems in the stations, where we have the exhaust systems in the station so that when you go into the engine room, it's actually being sucked out of the building through the tubes in the stations and through that system there. We've separated our turnout gear. We're still working on it at Taylor Avenue. It was budgeted, and some of the other cost issues that's come up with the city facilities monies. They haven't been able to finish that yet, but we're going to enclose that so the turnout gear is not in the same room as the diesel exhaust. So we continue to expand upon that. We do physicals every year. Our physical program is actually the program that caught the cancer for the one individual that we had. So we continue to work on our cancer initiative, and we will continue to do that. And it's watching the trends and watching what we can do. But all the plastics and building construction these days, everything's made with cancerous type materials once they burn and when they're off gas. So as you know, we've got brand new SCBA coming in. It was funded in the last budget. So all that helps with our cancer initiative program.
Thank you, Chief.
Next slide. All right, it's just this goes with our response times. This is just to provide a safe environment to the community. What I can tell you is that when people don't know who to call, they call the fire department. So we respond to all kinds of concerns. Sometimes it's probably not a fire department issue, but sometimes it's as simple as we got a call the other day because somebody dropped their keys down in a storm drain, and we were the rescuers at that time because we helped them get their keys back, and it really made their day. But what we do find is most of the time when we get called, somebody's having a really bad day, and we're just here to try to provide them a safe environment, and hopefully we can work through that and have a successful outcome. Next slide. This is our minimum staffing we talked about. Where we needed 25 people in those stations daily. Got to multiply that times 4. So there's your 100 people, and then you got to add 5 more per shift there for the people that are off. So that's where most of our people are. It's on those 4 shifts. But our goal, and we are not reaching this goal, our goal is to have 12 ALS providers per shift. We're down to about 8 per shift now. So that's where we're failing. And as we do continue to hire, when we have the permissions to hire, we're going to try to pick up paramedics that are already trained, because it takes 2 years. We could take a firefighter that's here now and tell them you're going to paramedic school. I don't believe in that because it doesn't necessarily make for good paramedics. And then the other issue is it's a 2-year program, so it would be 2 years out. So we've had success finding people that already have their paramedic certification and bring them on. And we'll continue to look at alternatives as we move forward. Next goal. There's our cancer awareness. I think we covered that one already. And we do work with our workers' comp attorneys to look at every aspect that's out there. And they also help us with some of the cases that are out there for things for us to look at. And that also includes our risk manager, Corey. He always looks at stuff for us too. Next goal. There's the enhancement program for the medics that we talked about. What we like to be able to do is have enough medics on staff that they can rotate. So when they're on the engine company or on a truck company, that they feel comfortable in their duties. Plus it gives them a little time off of the medic units. What you'll find is every time a medic unit goes on a call, we'll average at least a half hour from the time we leave the station while we're on scene. It's probably higher than that. And then we're over an hour at the hospital. So every time a medic unit goes out, if they transport somebody to the hospital, more than likely they're out of service for 1.5 to 2 hours. So we only run 4 ALS units in the city. So you can see how that time would add up with multiple calls a day. So we're trying to continue a rotation here to give our medics some breaks and off the medic units on a daily basis. Next slide. This is our outreach programs. We continue to do that. Next slide. This mobile integrated health program, it's sort of been on the back burner since the pandemic, but there's a lot that's involved with this, which includes alternative care where we'll be able to treat people on the scene, do some telemedicine. I'm sure some of you have used the telemedicine programs that are out there. We'll be doing that from people's houses through our providers to a doctor. So we continue to work on that. It has been pushed back a little bit, but we are continuing to move those programs forward. Next slide. Now, our long-term goal is to go back to the national accreditation. We believe the ISO rating was better off for the citizens of Annapolis, so we go after that, and we got that rating. So eventually, a long-term, and it costs money to get this other certification. We'll continue to look at that, but that's just a long-term goal. Next slide. And just mental health for our providers. We have found that throughout the nation, there has been an increase in suicides amongst first responders, police and fire. So we continue to watch that. We have a mental health doctor that's part of our contract services that's on staff for us if we need him. It's a very small contract that we have. And then we have our own peer review people, peer support personnel with our critical incident stress team management teams, which people in-house have been trained to do that. So for our providers, so they look at that. They look for signs and symptoms for our personnel. We utilize the city's EAP when necessary, and we can use our mental health professional if we need to. Next slide.
That's just quickly, that's very, very important. I'm so glad that you had that in there. And I actually was talking to Trisha Hopkins about this. Cities across the country are now programming in mental health days for their staff, so they don't have to, abuse a sick day or a family leave for a mental health issue. And I'm so glad you had that in the slide. That's great.
So we'd love to do that too, Alderman, but that would probably mean more people. And I've got the view that that's not necessarily going to be an ability to do. But yes, we agree. And actually, the International Association of Firefighters has a facilities. And Carol, why don't you just tell them about it, just because it's here in Maryland, so they know, just real quick.
Sure. So about 4 or 5 years ago, the International Association of Firefighters decided that they want to take care of each other. And so they actually purchased and built a facility in Prince George's County. It's called the IAFF Center of Excellence. And it's a one-of-a-kind facility in that they only take firefighters. And so if you have any sort of mental illness or substance abuse or chemical abuse or anything like that, you can apply to this facility. And it's an inpatient facility. It's covered by insurance. And you'll go there and they'll develop a program specifically catered to you. And you'll go there and receive the necessary treatment that you need. And it's pretty neat to see if you ever get a chance to take a tour. It actually looks like a fire station. It's set up like a fire station with the type of kitchens that we have. It's run by firefighters, and it's run by staff of the International. They've hired some of the best clinicians available, and it's just to take care of firefighters. I don't think any other profession has done as much to date as the firefighters have done. So we're very fortunate that it's here in Maryland, and we encourage our members that if they need that, to take advantage of it.
And unfortunately, we have had members that have had to utilize it. We had some concerns early on that our city medical health program didn't cover it, but it does cover it now. We've worked through that. So it's out there, and it is very good. Unfortunately, we ask our members to see things that nobody should ever have to see. And they see it a lot. They deal with death on a regular basis. And sometimes our coping mechanisms are different for everybody. And sometimes it turns to alcohol or other coping mechanisms. And we want to try to avoid that. So we do. We have people on staff. They're constantly watching. If we notice somebody's, their conduct, or they just are withdrawn or something, the peer review people will reach out to them, and hopefully, we can work through that. So we are very proud to be able to help our own. Next slide. We talked about the mobile integrated health. It's a long-term goal that we want to continue to work on over the years. Next slide, because I know you want to get back to the budget here. So another long-term goal is just to continue with the facilities maintenance as the city does. They have a budget every year through your budget process. There's money set aside for city buildings. Unfortunately, every now and then, like the Stanton Center had an issue this year, the HVAC system at the police department had an issue. All that money comes out of the same pot of money. So this is just on the agenda to continue to put money into the fire stations. As most of you have probably seen, the Eastport Station for the last few years, we've been doing a little bit here and there with city funds to improve that building because it had gotten old and it wasn't being kept up. And it's turned out to really work nice because it was on the capital improvement project at one time to knock that station down and build a new one. Obviously, it wasn't cost effective for the city. So we put some money into the building and that building will be able to last us for some time. Next slide. Because I know we're going to get back into the budget here where you want to see things. This is what I talked about earlier, the $21 million, salaries and benefits, $20 million, fleet services right off the top of the bat, fuel, maintenance costs, that goes to fleet services because that's the way it's budgeted throughout the city. Within the last few years, it was changed where fleet management had their own budget, but it's now charged to the departments, and this includes funding for the mechanics and fleet services. So that's $640,000. There's salaries built into that. There's mileage built into that. There's other costs for the apparatus to stay on the street, but that goes to fleet services to manage that budget. If you have any other questions with that, I got to refer to Jody because that cost comes from fleet services itself. But that's what it leaves us. It leaves us, after you take that stuff off the top, I know Jody doesn't necessarily call it operational costs. We've had this conversation back and forth on what's the operations budget, because typically that's salaries and all, but that's the $942,000 is what we have to get medical supplies through the year, to get turnout gear for our personnel. If we have to replace ballistic vest, advanced airways, a cardiac monitor goes bad, that all comes out of there. It comes out of these funds. So I can tell you that we manage the budget well. I know it's a lot of money when it comes to our budget, but we do everything we can to stay within budget. And I'm very proud to say we have been able to stay within budget over the last few years. Next slide. Here's your comparisons. So this is it. This is where the difference is between the current budget and the proposed budget you're going into. And you can see the big costs right there. The salaries are going up. The salaries are going up because there's negotiations with the union for pay increase. This is the 4th year of it. We've had some conversations about looking at the overall pay scale in the city, and just take a look at that and look at how we do increments or step increases, and make sure that we don't outpace our salaries, don't outpace our income, because we all, I guess, would agree that. I shouldn't say I guess. We all could agree that we're probably getting to that point that we really have to look at that to make sure our salaries aren't outpacing our income, and that's there. But that increase is that. It's a very small amount of inflation for the overtime cost, but it's that. And then the benefits, I'm sure that is most of it's going to the police fire pension plan. That's been increased, that you've agreed upon, or this administration's agreed upon, to try to get where it needs to be, and which you will find, because if you talk to the police and fire unions, that over the years and years past, and I'm not saying it was this administration or this council, but multiple years ago, we weren't probably, as the city, funding the pension plan the way we needed to be. So we've been playing catch up, and this is the cost of catch up. So that's where those costs are. Our employees' physicals, yes, we do. It's an NFPA requirement. We've worked hard over the last few years, to be able to get each employee a physical every year. We were doing it on a 3-year cycle, but that did not meet the standard. Now our hazmat physicals for our people in hazmat and Swiftwater are more expensive than a standard firefighter physical, but those physicals are all built into there. So that's the physical cost. But the increases you see here on that, short the salaries and benefits, is just basically a modest increase for inflation over the current one. And I think that was 3%, Jody, is that what we were putting in there? 2%. So either way, so that's it. And that's that fleet maintenance cost that fleet maintenance said was required this year. So that's increase you see down there. And fleet maintenance said that this year's current budget should have been budgeted at 660,000, and it was a decrease, but our current budget was only funded at 611. So I'm not sure where that falls into with fleet services, but that's the cost of fleet services came up. Can you go to the next slide?
This is great stuff, Chief. You really saved some of us a lot of work by laying it out like this.
The 750, like I said, that's all that small increase for inflation. Now supplies are increasing 23,000. We needed more money for supplies. So pandemic is hurting everybody. Costs for medical gloves went up 40% in October, and then they went up 100% in January. And we are on an allotment. We can only get so many latex gloves a month, depending on the amount of gloves we're using. And we calculated it out, and the funds they needed to be higher. Now we have been able to, with some COVID money and some money from the state for protective equipment, to stockpile some gloves. So that's why I did not put in, plus I also knew that the budget was going to be a concern. I didn't put in for the 40-some thousand increase that we believe it was going to be. We believe that the increase requested 23,000 will help us get through the next year, but medical supplies are going through the roof. It's bad. So we'll continue to watch that as it moves forward, but that's what that 23,000 is there. And then you can see everything else there. I'd like to say, we saved the city a whole lot of money because we're going down $900,000 in our capital outlay. But that was the one-time cost for the SCBA that you approved last year. And I think all of you do know it, that I assured you that we would look for alternative sources of money for that. We were able to get a grant for at least half of that amount of money. So Jody has that in the calculations, but we did not spend in this current budget of the 956,000, 516,000 was able to come back to the city because we were able to save that money and still get the brand new SCBA through a grant process. So I know that comparison is probably one of the biggest things there. And I don't know, Mr. Chair, if you have questions, because that's the biggest part of our budget.
No, I think we're almost wrapped up. And then, Alderwoman Finlayson, I think we have some other people on time-sensitive schedules, so I do have questions, but Alderwoman Finlayson.
I've been making my list, so thank you, Mr. Chair. I've been waiting until the chief finished. First of all, Chief, I agree with Alderman Payon. This has been an excellent presentation. Helps us to better understand all of what you do. And I consider your department one of the most valuable in our
mute.
We lost you.
Yeah, lost her.
Am I on mute?
Yep.
Okay, sorry. I know from surveys of the past that the community holds you in the highest regard. So I want to say thank you for sharing with us all of your data and helping us to understand the complexities of what you do. And I'll come back to that in a moment. I have 3 questions. One, you mentioned briefly the time spent at the medical center when someone is transported. I know in the past we've had issues with tying up our medic units at the medical center after taking someone there. Have we fixed that problem?
So the hospital,
has been reduced?
The hospital has worked hard to try to address it. The pandemic has been nothing but add to it. So we work with the hospitals every day. Our EMS supervisors go out there and try to facilitate getting the patients in the hospital and transferred over to bed. It still takes about an hour for a medic unit to be on the scene. But on average, we're seeing probably 30 minutes now. But there are some horror stories out there where our units are there for 3 or 4 hours and they go on reroute all day long. They had an accident on the Bay Bridge the other day, head-on collision, westbound span of the Bay Bridge. Well, we had a medic unit to transport it to Queen Anne's Medical Center. our medic unit was stuck on Queen Anne Sound side of the bridge because all the area hospitals around us were to capacity, and we can sometimes get there or get to Bowie Health, unload our patient and get back to the city before we get out of the local hospitals. So, but we do continue to work with that. The hospital has been very good working with us. As we see an uptick in it, we send some of our chiefs over there and we have conversations with them, but it's not, it's just not Anne Arundel Medical Center. It's not just BWMC. It's all the hospitals and it's the healthcare program together. And that's why we're working on the alternatives with being able to do telemedicine in homes, which we're very close to getting done. And actually, for the first time, we will be transporting a patient to an alternative facility, which may be Right Time Medical for some of our lower priority calls, which is an agreement and an approval we've gotten through the state to try this program. So we're still working it. We're working through it. The pandemic has really slowed that down, but we're looking at every avenue we can to try to reduce this.
Well, good to hear. And I'm glad that you have the supervisors that are able to work on that while the EMTs are out on the street doing what they need to do. Second question has to do with the integrative health program. Do you have the technology? Do your men and women have the technology on hand to do that type of medicine, I guess?
Chief Spriggs?
So we do. I think we're going to partner a lot with the county to perform some of those tasks. But as far as the technology portion of it, yes, ma'am, we are adequately prepared for that. Obviously, nurse practitioners or physician's assistants would be helpful with that program. And that's where we would partner with the county, maybe to pair one of those types of clinicians along with our paramedics to get out and treat patients in their homes.
Well, great. I just didn't know whether we should expect to see a capital, CIP item, but no. Okay, third question, crisis response. Help me to understand the connection. And Chief, I spoke to you last week and thank you for sending someone over. We had someone in crisis as a result of a homicide. And I'm still not clear on what the police do, what fire does. How do we get the services we need to get to the community when they are in crisis? Who makes that decision? And I kind of think, and I'm asking because you're the medical folks, who makes the decision to help them get to the right level of services that are needed?
So we call the county crisis team when somebody comes to the station and is seeking help. That's the fire department's, basically that's the main time we ever call the crisis team. Any other times for an incident where there has been major trauma, shooting, stabbing, multiple patients, that's run through the police department, and they would call them to the scene at that point because we truly are the response agency. We respond there. We try to treat the patients. We take them to the hospital. But after that point, we're basically out of the loop there. And even with the safe stations, we're the facilitators for the safe stations. We get them pointed in the right direction. We get them into the system. But at that point, it's out of our hands, and it goes to the crisis team from Anne Arundel County. So any other call for that? Now, we can call them. They will come out if we request the team, but it's usually facilitated through the police department.
Okay, thank you. And I did talk to Jen Corbin myself. I went straight to her last week when we had the problem. Well, thank you, Chief. And I have one suggestion, and I'm not sure how practical this may be, but I have had the opportunity to go through a burning building with your staff. Happened to be a building in Eastport. It wasn't really, it was a simulated exercise. But I had an opportunity to walk through as a civilian to see just a tiny bit of what your men and women have to do. I've been on hand for other fires, such as the one on Spa Road, to see you guys, men and women, in action. So let me suggest, if it's doable, that my colleagues be invited to do something tantamount to a ride along. so that they have an idea of the intricacies of what the fire department does. You know, putting out fires is a big piece of it, but there are a whole lot of other nuances that impact the success that we have had in the city with our fire department. So again, I want to say thank you. This has been an excellent presentation, and I hope all of my colleagues will have an opportunity to see your entire presentation and digest what you've shared with us. So thank you, Mr. Chair.
Thank you, Alderwoman. Alderman Payon, before I go to others, did you have any further questions?
No further questions.
All right. If we could go back to the slides, or maybe we don't need to, but Chief, I had some questions about the response statistics. It's, I don't know, about a third of the way in. I'm seeing EMS calls for service of 7,403. And that's about 20 calls a day. Given our aged population and being somewhat of a frequent flyer myself, I don't, that statistic looks right to me, but I was surprised. It looks like we have on average a little over 8 fires in the city a day.
So the fires, the fire-related calls are just that. They're fire-related calls. It doesn't necessarily mean it's a working fire. That could be smoke in the building from burned popcorn. That could be a fire alarm system going off. But all those
go further back, Julian. It's more towards the front. Sorry, Chief. A few more.
Right there.
Yeah.
Go back one.
Thank you.
So that 3,000 calls includes alarms sounding in buildings. Like I said, smoke from popcorn in the microwave that set off a smoke detector. So it's not necessarily a working structure fire, but it's a fire-related call. It could be that sparking electrical outlet. All those fall under a fire-related call.
Okay. So it's probably the hazmat calls might be somewhat similar.
Hazmat calls, or we get a lot of chemical odors and structures, CO alarms or CO calls. So they all fall under the hazardous materials calls because they are hazardous materials response.
And some examples of things that are in the 729 other?
Getting the keys out of the gutter.
Okay, yeah.
I got to say it because we've done it this year, getting a cat out of a tree.
Okay.
Child's locked in cars, lift assist. We do get a lot of calls where we have some of our citizens that have fallen down and they can't get back up. And we will send out a crew to help that. And even some of those calls where we've had some that they've had problems just getting from their residence to their car to be able to go to a doctor's office. That would be a service call also because we can help those people get to their vehicles. So that service calls is a wide range of calls.
Okay, thank you for that. And then flipping about 3 slides ahead, the plan reviews, 540. That's for a city that has a reputation of not processing plans quickly. I think it's one more slide. It's 540 plan reviews. So that's a lot of reviews.
It was definitely 500 and some reviews. That's what we got from the fire marshal's office. That does not include any inspections that they do. That is just the plans review process that they go through. So that's the documentation we received from them. Correct, Chief?
Yes, it is.
Okay. Thank you, Alderman Gay. I see you have your hand up. And I can't see
I didn't have my hand up, but I did have a question.
Oh, all right.
That was from earlier, probably. It's more of a comment, and I would like the chief just to elaborate on it a little bit more because we have discussed this. One of my amendments is, and I found the money. I've already found the money. It just now needs to be approved, hopefully by the council. Is to move some monies to help you start the program for very similar to what the police department does. I'm blanking on the name now.
Cadet program.
What's this called?
Cadet program?
Yeah. Yes. One. And so could you just explain how that could help? So once we get to the point where the amendment comes up, they'll just have a little background information.
Sure.
Chief Spriggs, you want to take it?
Sure. So one of the challenges that we face is reflecting the community. And we hear it often, and we want to be a diverse department and a diverse organization. And sometimes it's really, really limited when we offer specific job announcements. For instance, if we announce a job opening and we limit it to people that are already certified as firefighters and paramedics, it limits our candidate pool because people in the community haven't necessarily been able to go out and obtain that certification as a firefighter or obtain that certification as a paramedic. And so right off the bat, we're pulling in people that are not from the community, and we're not allowing the people in the community to have an opportunity to even get a great job here in the city. And so our thought process or our hope is that we could develop some sort of cadet program, and whereas we could target people, between the ages of 18 and 23, and provide that training for them so they can become certified as firefighters, as EMTs, and then pay them, and they work, a minimum number of hours, and in the hope that at the end of that cadet program or that period, they would actually be able to apply for a full-time position and then transition right into the fire department with the certifications that are needed.
So Alderman, early on, we talked about this when I became Chief Spriggs and I, and we actually talked to some members of the community. I gotta tell you, I wasn't really for it because of some of the stuff you even brought up. Sometimes it says they feel like the fire department's doing too much, and that is a program that's going to take time for some of our personnel to train people, and that training division would be tied up doing that. But as we've worked through some of the pandemic, some of the crisis we've seen in the communities, and listening to the community about trades, we feel that this was a way for us to try to start sort of like a trade program that, we could bring people in here to see if they are interested in being firefighters. Now, it's not going to be an easy program because they've got to pass all the training courses that we put together, which is the same that the Maryland Fire Rescue Institute would put out. And, they've got to pass with a certain percentage, and they've got to be willing to go into burning buildings and that type of stuff. But if there are people out there that want to do it, and that's our goal. Our goal is to try to do it like a trade program, like the cadet program, because it would bring them in and it would give them an idea. Hey, is this the direction I want to go? And that's where we need to be. It would be sort of a paid internship type of program. That's what they pay the cadets, and up to 30 hours a week, and would be up to a 2-year program. We sort of looked at Washington, D.C.'s program. They have an 18-month program that's worked well for them. And we ran into some challenges, so we have to figure out how to make this work, because we were looking at our communities here in the city of Annapolis, and we're not too sure that the law office is going to allow us to just do the communities in the city of Annapolis. We've gone back and forth. We have some challenges to work out between HR and legal to see how we can open it up and who we have to open it up to so that it's a fair program. But yes, it's something we are interested in. It's just you didn't see it in this current budget with us because we know how tight the budget is, and trying to add a new program is sometimes hard. And I told the alderman all of you earlier that I've heard you loud and clear. If you want something new, you got to do it within the budget. That's why the fire protection engineer that I brought up, it's within the budget, and we believe we can do that. I don't have a way within the budget currently to start this cadet program or internship, but we'd like to do that. It's something we want to look at in the future.
Thank you for explaining that, because I think it'd be great for all of the obvious reasons that you laid out. And particularly, some of my colleagues talk about wanting to see a police chief from the community. It'd be great to see fire too. Fire, police, everything. Planning and zoning director. I think that these opportunities that we're extending to members of our community, as Chief Spriggs mentioned, they wouldn't otherwise be able to do so because of the costs and the travel now that it takes to go through these programs. I have two friends in the city of Annapolis. Different communities, both interested in being in fire. One male, one female. The young man went through a program for about 2 weeks, but then he just couldn't keep up the commitment because one, it wasn't paid, and two, he was traveling, I think it was definitely like past Pasadena or something like that. The young woman, she's still in the program, but her problem, and she's, paying her way through, and she wants to see this happen, but she's got to drive across the bridge to get into the internship program. And so, me and Ross talk about this all the time. Providing people economic opportunities in these communities is the great divide. That's how you really help people out. And so I think I found the money through a number of amendments. And so I'll sit down. Obviously, we just got the email. They got to be introduced on the 17th. But I'm eager to get this through, and I hope we can assist the department in this.
Thank you, Alderman Gay. Thank you for the warning on the amendments, and also sorry you only have two friends.
So, Mr. Chair, is Alderman Savage still here? As I'm hoping I answered his question.
No, unfortunately, I think he had to leave, but I did have a question. I know we've spent a lot of time, but your budget is worth the time. And I wanted to go back to the services. We don't have to go back to the slide, but there were 3 services at the end, and particularly the very last one, Junior Fire Starters Intervention, but also tactical medics and bike medics. Those were actually new services that you may have explained them to me before, but I really hadn't focused on them, and I think they're kind of interesting sounding.
So the tactical medic program is just that. We provide tactical medics who are trained to go along with the police SWAT team. They are unarmed. They are not law enforcement officers. They are medics on the scene. If you remember, it was probably in the 80s. It was either the 80s or 90s where our police SWAT team was on a raid. And we had a police officer shot, and we had a suspect shot. They loaded the police officer in a car and drove the police officer to Anne Arundel Medical Center. And he waited at the hospital for hours and hours and hours until a surgeon came in, and he got treated. The suspect, who was also wounded, got treated by one of our paramedic units, ended up in shock trauma, and was basically treated and released prior to that officer being done. We did not provide medics to the SWAT team at that time. Since that, we have. It's a small number of medics. It's another one of those collateral duties. It's not like, they're full-time medics assigned to a SWAT team or something. It's just a collateral duty where they're trained to do that. They go with the SWAT team. We've also found that sometimes in a barricade situation, or even sometimes when the police are serving warrants, that some people in the community, it's a traumatizing event for them where they have some trouble breathing and get very anxious. And we have medics right on the scene to help them work through whatever their issue is at the time. So that's what the tactical medics are. The bike medics they're a special events team. They're used for some of the races in the city. Now, when we do have the foot races and stuff, those medics and all are paid for by the permit process. So that is a reimbursable cost. But we can get the bikes to the runners quicker than if they were in a vehicle, because we got to get through the crowds. They're also used for like the 4th of July and some of the Blue Angels details, where lower end of Eastport and downtown is just chock-a-block, where we can get medics on a bicycle to the scene. But we've had bike medics for several years. The original bikes were donated by the Optimist Club of Annapolis, and that's how we got the bikes. And the bikes are stored at the Taylor Avenue station. And the Juvenile Fire Center program is done through the Fire Marshal's office. It's for those young individuals who go out here and start fires, not necessarily to burn down a house, but are very curious. And instead of them ending up in the juvenile justice system, we have a program out of the Fire Marshal's office where they can go, and it's an educational program where they sit down with one of our juvenile fire education specialists, who is a code enforcement person. It's one of our civilians that works in the Fire Marshal's office that does inspections every day. And they sit down with them and they actually work through this program. And it even actually works for some of the ones that actually got juvenile citations and were in the juvenile justice system, is that instead of them having to instead of them getting in trouble, they go to this program and it's wiped clean for them. So it's not a problem for them. It's not an actual charge for them. So that's what that is. We only have a half a dozen to a dozen a year that they deal with. But even if you had a neighbor who had a grandchild or a child that was just out there lighting matches, setting papers on fire, that's what this program is all about, is just to educate them on how severe it could be.
Okay, thank you for that. I think Alderwoman Tierney had some questions.
Yes, thank you. Thank you, Mr. Chair. Thank you for the presentation. I think one thing that came out of it is that you are very cognizant of the budget constraints and trying to do the best that you can. And I really feel that the opioid epidemic has disproportionately utilized your resources, and that we all need to know that this is sort of a universal problem citywide, and I truly believe it has disproportionately affected your resources. I think that we can all agree on that, and you've had to react quickly. And my concern, and I think you talked about it, Chief Spriggs, is the retooling and retraining required to respond to this within budget and yet not sacrifice your response to fires. Could you speak to if you have added money for training or how you're addressing that need?
So the training of our personnel is done through their recertification process, which for EMTs, it's every 3 years. For medics, it's every 2 years. And then if we have a protocol change, we do protocol updates every year. So that's done during our normal training program. It's the program that where we send our people out into the community and train those people in Narcan administration. That's where some costs come into it. Now, Chief Simmons has gotten us some funding to allow for the overtime to pay for that. So it's not coming out of our city budget because that's what taxes us, is those special events there. Because the $600,000 that's in our overtime budget is basically there to staff the fire apparatus and medic units. There's some special events that's built into it that may or may not be reimbursed to the city, but those type of situations with the pandemic, that's what's coming there. But we are always looking for alternative sources to fund these things. And I just want the whole council to be assured of that. The Chief Spriggs and I are always looking at ways to do that. We're always looking for some grants to help us out. And Chief Simmons and the members of emergency management do a good job also of facilitating that through the state funding and getting us money for that. And we were out of money for the Your Life Matters program, and they were able to get that up and running here within the last few months. But the pandemic is it. We're running overdoses on a regular basis. We just realized that we're probably running more than it's on the opioid. Well, we know that we're running more because we get calls for people down and they're not there when we get there. There's several people in the communities that have overdosed, and the Narcan that's out there, they were able to leave scene before we get there. But we also have some situations where we found that we've treated overdose patients, but it doesn't make the opioid map because the police department weren't involved in those calls. So we have to make sure that we're calculating those too. So that pandemic that's out there is worse than what you're seeing on the opioid map. And we just realized that recently, that there may be some that we're doing that is not being tracked.
Well, I'm separating the opioid from the pandemic. I mean, I think the opioid is a pandemic in and of itself. And I just think that my colleagues really have to understand how this has detoured you. And we need to help you figure out how to realign your resources within budget. As far as the fire protection engineer, fires clearly demonstrate the weak link theory. They find it. And fire protection engineering is relatively a new science. Well, when I say new, like 1990s. And it looks to address Ross Arnett's concern about Watergate. The fire engineer, he looks at the building as a whole. He'll look at the walls and the heating system and all that, egress, and have a proactive approach ultimately to save lives. And in the long term, it will diminish reaction costs, but only theoretically until we actually see what happens. But my question is, how will you align this new position? Because sometimes fire protection engineers are tasked with inspections. But I see that you have 2 inspectors. So could you just tell us how you're going to realign that new position with the existing fire protection inspectors, so that my colleagues are clear that we're not duplicating efforts?
So, well, the first thing is it'll allow those inspectors to be out and do more technical inspections, and not have to do the plans reviews themselves. Because some of the smaller plans reviews are being done by firefighters or the fire marshals in that office now that have been trained in plans review. My goal is to have an engineer review all the plans, and then our people go out and do the technical inspection. I think that's better off for everybody in the city. The other thing is that while you saw those 2 civilian fire inspectors, everybody on the fire engines and the ladder trucks and the medic units, they go out and do fire safety inspections. They have to do so many a month. So they're not the only ones out there doing the inspections, but this will just enhance it. And then this person can help out when there's technical questions arise about an exit and whether or not they need another exit. But it will be the fire protection engineer gears more towards the stuff that's related to the permit process and not necessarily just a standard fire safety inspection that's done yearly as required by the code for like the historic district or NFPA.
Yeah, just so my colleagues understand, the fire marshal review is usually a bottleneck, i.e. costs in permit review, because the fire marshal will reject the plans and then they have to go back. With this added fire protection engineer, we'll be more proactive in assisting the client, if you will, with the best way to protect their building so that it doesn't get rejected by the fire marshal in the 11th hour. So I believe it's ultimately a cost savings, theoretically. So thank you very much. Thank you again.
I truly believe it'll be a benefit for the public safety and the public safety systems in the buildings, without a doubt. And this person being on staff regularly Monday through Friday and not a contract person where you get them when you can schedule something with them, it's just going to help the permit process altogether. And it'll help with some of those technical questions that come up about some of these buildings. Because everything, and especially your district down there, the 2nd and 3rd floors of Main Street, you have to have a second means of egress, and how can you get around that? I believe having this person full time can help us with some of those unique challenges we run into. It's not going to cure everything because we still got to meet the code. We have to meet the code, but we just have to be comfortable in what's going on with the code. So yes, I of all people, taking a uniformed person out of the field and converting that is hard for me, because that uniformed person, I can put them on a fire engine or medic unit or whatever I need. But I truly believe that this engineer downtown, having this additional engineer downtown, is nothing but a benefit to the citizens and the city in a whole.
Thank you. Thank you.
All right. Are there other questions from council members? Alderwoman Pendel Charles. Welcome aboard.
Good morning to everyone. Thank you. Sorry I'm late, but you know how things go. But 3 things I want to mention. Number 1, I have had a detailed conversation with Chief Romali about the budget and what he was going to present. And I'm usually in regular communication with he as well as Deputy Chief Spriggs. And so I'm very comfortable with what they have submitted for us to consider. And so the second thing I want to mention is my normal concern, like with public safety, is how does this affect our Class 1 certification? And so for me, because we offer such wonderful services, and we are Class 1, which is extremely unusual, it also affects our insurance rates. That's usually the first question that I ask. What are you doing that can enhance Class 1, maintain Class 1, or what's going to prevent us from continuing to be Class 1? So that's always my question when we come to the budget. And number 3, to respond to Alderman Gay's concern, as well as mine, as far as getting of people and young people involved in the fire service. As many of you or some of you may recall, back in 2019, we, the mayor, through Adetola Ajayi, as well as Archie Trader, our Director of Rec and Parks, and Mr. LaRon Fisher at HACA, we developed some pop-up camps for the city. And one of the pop-up camps was a camp for children at the fire station. And it was extremely successful, getting children acclimated. I believe it was some 5th, 6th, 7th graders. That was about the age range. We served them pizza, but they had an opportunity to see up close and personal what it's like to be a firefighter. And that kind of starts to whet their appetites. And we did several pop-up camps through the police department and through some of our other departments, fishing camp and those kinds of things. So we wanted to do it again in 2020, but of course, COVID came, and we want children to have the on-hands, on-site experiences of things. And the more opportunities, like we know in the school system, the more opportunities that children have, the more choices they have as adults as to what they think they might want to go into as an adult. And so that pop-up camp was really successful. We wanted to do it, like I said, again last year, but hopefully maybe we can do some sort of similar thing this year. I know Maria Brown was going to do one for planning and zoning. And so just using our own departments as pop-up camps as well as outside entities. But Chief or Deputy Chief, you want to give the council a little more enlightenment on what you all did exactly with the children in the summer of 2019.
Chief Spriggs.
So kind of put me on the spot because I don't have all those notes in front of me. But I do.
It's okay.
I do specifically recall the camp, and for some of the kids in our community, they had walked past the fire station, but they couldn't tell you what was inside the fire station. And so for some of them, it was just getting into the building and interacting with the firefighters. And I specifically remember some of the little girls that came through. And some of them were shocked that there were women working in the fire department, but not only working in the fire department, driving the fire trucks. And those lasting impressions, it just shows them that there's that opportunity. But we went through it and we had discussed fire safety, and they were able to pull some hand lines and flow some water and just do some little things around, just showing them some of the opportunities, some of the things that the men and women in our department do every single day. And just to have that exposure, like you mentioned before, it just opens so many windows and gives them just another opportunity, something that they probably could have never envisioned, because your everyday person hasn't gone into a fire station. And so some of the kids were asking, well, why is there a kitchen here, or why are there beds in there, or why are there, this and why is there that? They just didn't realize that people spend 24 hours in a station. It's like a second home, and it's just educating those kids and showing them the opportunities that they have right here in Annapolis. And I just thought it was fantastic, and we look forward to doing it again.
Great. That's wonderful. And we had, I guess it was about 3 years ago, an adult job fair down at Pip Moria through the mayor's office again. And we ran into Chief Spriggs, Deputy Chief Spriggs, and I talked to 3 sisters. I think they lived, as I recall, in the Bywater community. All of them had gone through Red Cross training, but they had expressed an interest in becoming firefighters. And they were all, I guess, in their 20s. And so Chief Spriggs and I said we were going to keep in touch with them. And so the program that they're outlining today, definitely want to go back to those 3 sisters. I think that's probably something that you may not see in the country. 3 sisters who are interested in that. So Deputy Chief Spriggs and I are going to work on that and continue to have a conversation with them as to see where they are and if they can come into the fire service. But thank you all so very much for the opportunity. And this is wonderful. And like I said, I try to keep tabs, of course, just like with Kali and the police department. We have a Class 1 fire department, and we want to make sure we maintain that and don't want to do anything that would disrupt that huge benefit that we have in the city of Annapolis. So thank you so much, Mr. Chair, for allowing me the opportunity to speak today.
You're quite welcome. Are there any other questions before we wrap this up?
Just one last, our colleague had a question, but he had to leave early, so I'm going to ask so he can watch later. He wanted to get a better understanding of the fire marshal's office and how it has expanded over the course of the last couple of years.
So I was going to warn about that. That perhaps is something we can take up Tuesday evening when we meet again with Police, Fire, and Public Works. It is something that has been bouncing back and forth on text messages and earlier conversations. I don't know if you have any direct response to that now, Chief or Deputy Chief, but I'm sure it's going to come up again tomorrow night.
Okay, yeah, we'll look at it.
Okay.
I don't believe that the code enforcement has really grown in the last few years. There was a request early on after some of the fires, and they added a life safety inspector to the city of Annapolis, where originally it was going to go in the fire marshal's office and ended up going to Public Works, and then eventually we added the civilian fire inspectors to it. But the number of people in the fire marshal's office is not really grown much over the last few years. But we'll take a look at it.
Okay, so I think that part of the impetus, pressure, whatever that the council is feeling is looking at where we can save money. And since, as you pointed out, 93% of your budget and almost all of your operations are people, getting people to the hospital, getting them medical services, putting out fires, those sorts of things, we tend to focus at around the edges. And so I think that's one of the reasons why Fire Marshal's office has drawn some attention. One of the penalties for providing such a thorough and clear presentation is it invites a lot of questions from us. So
I understand.
No good deed goes unpunished. But I do, like my colleagues, want to thank you for this presentation. It's always good from Fire. You really do have your act together, and we appreciate it. And I think the questions are all being offered with the best of intentions and to truly learn more about your operation. So we appreciate the presentation. If there's nothing else, we'll thank you. And somebody before we started this meeting said, oh, this should run very short. Here we are at 12:12 and we're just getting to finance. So, and they have a nice presentation for us too. So without further ado, if we can turn it over to Director Dickinson and we can look at the PowerPoint presentation from Jody and Katie, we can move on towards a late lunch.
Can I ask one quick question?
Oh, certainly, Chief. Sorry.
So obviously I took up 2 hours of your time today. Tomorrow night, when the full council's there, I'm guessing you're not planning on going through the whole presentation, correct?
No, I think
it's question and answer.
Correct. It's going to be question and answer time. Why this? Could we do less of that? Could we do more of that? And I think that'll be a time actually where you can spend more time talking about the new fire engineer. As Councilwoman Tierney pointed out, there's some interesting aspects, I think, particularly downtown, where we're trying to get rid of knob and tube and things like that so we could effectively use the buildings down there. And we're trying to push that with the sprinkler agenda. So I think there's going to be some technical questions along those lines, but it'll be mainly focused on what can we do to cut costs.
Okay, thanks.
Sure. Thank you. All right, Director Dickinson.
Yes, so I wanted to check with Julian to make sure you had the one that Katie just sent. Julian?
Yes, we have.
Okay, because I sent, and I will have you, Takia, send this to the council now. We just added a couple slides. I had left out the information about finance non-allocated, which is a big section of our budget. So I didn't want to leave that off the slides. So you would have those tables for comparison and some of the notes. But it's a little crude because we just kind of copy pasted it from what's in your budget book, but we can run through those really quickly. Yeah, there you go. Okay, so I'm gonna drag the pictures up and I won't be able to see everyone as I drag this over. So chime in if you have a question. Okay, so I would want to start out by saying thank you to the Finance Committee and the Council for allowing me to take some time to talk about the Finance Department today. And especially to Katie, who put this together for me ahead of time so that I only had to do the tweaking at the end and filling in some of my own slides. Katie's been instrumental, as you know, this year. The process of pulling documents together, book together, the legislation together, and OpenGov for everybody. She just worked so hard, and we now, it went faster than last year, and last year went faster than the year before. So it's really paying off having some great staff in the finance department. So here are our functions, and Katie's provided us this lovely picture art here that you see, which is basically what all of us here in finance feel like every single day. We have multiple functions, as you see here: accounting and financial reporting, the budgetary reporting and monitoring, billing and collections, cash, investments, office operations, which is where we put accounts payable and payroll. We do the debt issuance and manage that debt. And we take care of grants, accounting, and reporting. And as you know, I have a risk manager and Corey Bradley and the purchasing division. Next. Here we've just given you the snipped table from the budget book. As you see, still have the same number of employees. There's a little bit of trade-off in the different levels of the accounting associates, and one of them is going down because of the addition of the assistant finance director. Next slide. And we have the 3 in purchasing. I'll go through each of our functions quickly and talk about our goals and objectives and benchmarks. At the bottom of each slide, I try to put a little bit about progress because I know a couple of you have been asking about the progress on some of these, so I just kind of put that in there. In some cases, there isn't a lot of progress. As you know, we're a little strained on the resources now. One of our goals in accounting and financial reporting, we want to maintain timely and accurate accounting records and strengthen our internal controls. And this is like the bedrock and the foundation of everything we do. One of the things that we're trying to do is make sure we're doing all these reconciliations on a regular basis so we know the accounts are accurate. And we're going to establish a reconciliation calendar. And then, of course, a benchmark would be to have that 100%, that reconciliation 100% develop and the deadlines met. We want to ensure that all of our revenues expenses are recorded in the correct accounts, including capital projects. This was especially notable when I first took the position here, and we've made some strides. We're now making sure capital projects record all revenue and expenses, but we do still have some older ones that aren't consistently recorded. The next objective here is conducting risk assessments and audits of departmental activities. I think that this is critical, and I wish we had time to do it. I don't have the staff to do it or the time to do it now, but we have departments out there that are, because of the nature of our activities, they're handling cash, taking in payments, and going out there and assessing what could go wrong. It is critical. So I'm hoping to at some point in time get to this. The progress, I'll wait and see if you have a question on this. I've just kind of noted here that in a very quick way that we've established a recon plan, but we're not particularly tracking it right now. And, but we do see a decrease to the number of adjustments we've had each year. And we see that notably when we're getting ready for the audit, and we find things that we haven't recorded that we need to catch up on. Those have been going down every year. And we haven't done any risk assessments from this department. Next slide. Budgetary reporting and monitoring. I know this is of particular interest to the council and other outside stakeholders. We want to be able to provide accurate and timely financial information to the departments and other stakeholders such as the council, so you can see how we're progressing on budget. One objective that we set here was a quarterly internal budgetary compliance, including the status of each capital project. We were trying to get these budgetary reports to the departments and the council by the 15th of the following month. We came close to that it's been getting better. We came close on the December 30. We got those out in January. This one that's coming along is going to be a little bit late, of course, because Katie is the one that prepares it, and she's been tied up lately. We also want to develop, maintain, and evaluate long-term financial projections. As you know, this is one place where we need some improvement. It would be nice to have 5-year projections. It's hard to project that far out with government, especially when we don't know what our union contracts are going to look like, and it's hard to project revenues, but it'd be nice to have a system where we can set what if scenarios and start plugging in those what ifs and develop different 5-year projections. And our objective also was to implement the OpenGov software. We've come a long way since last year. We're now doing the budget book, as you know, with OpenGov. It still needs some cleanup, but mostly that's from the software side. They have to make some improvements to the software because we're using a brand new product of theirs. And we do have some public facing options in our OpenGov modules that we need to start using more. Again, that's going to take some time and more staff to try to develop stories that we want to tell to the public about what's happening at the city. Next slide. Our billings and collections division, they're very busy. There's 5 people in that division. We want to provide accurate and timely billings for utility, CFA, and general billings. One of the objectives is to standardize and consistently apply payment and adjustment policies. We're starting to do some of that. We did a little bit last year where we updated some fees. But there's still some things we need to do about setting some policies that allow some flexibility in waiver of late fees, because as of right now, the finance director has no authority to waive a late fee. And as you know, we had some real issues with the mail delivery over the past year, especially around the holidays. It got really bad. And it's hard to tell people no when their payment's in the mail for 6 weeks and doesn't get delivered to us. And it's hard for us to be able to tell, yes, when did it actually get dropped into the mail, et cetera. So it would be nice to have a little flexibility there, but we still need to set a standard policy. So I'm not allowed to waive late fees every time. We've got to have some flexibility, but not a lot. We want to be able to provide residents with timely, consistent, well-informed, and cordial service. And, in order to do that, we want to be able to decrease the number of customer complaints and even increase the number of positive statements the citizens have to say about us. You know how it is on our end. We care a lot about the complaints and not the good stuff, but occasionally we do have somebody that contacts somebody and sings our praises and how well we handled something. We are not tracking the number of complaints. It's difficult to do that. You're not sure on the phone when you've worked with somebody and you've resolved something, whether or not they're satisfied or they're still not happy. And we talked a little bit through creating some kind of OpenGov survey thing that we'd be able to have a form online that they could go fill out if they wanted to say good or bad things about the service they received. So that's something we might look into as a way to track these complaints. Next slide. On the cash and investment management, this is a big job. We've got to protect the city deposits and try to maximize the related earnings, which is really difficult since we've got to keep our cash and investments safe. And the interest rates right now are so low. We have to maintain collateral back. One of our objectives there is to maintain collateral on our cash balances, and we do. We have an agreement with Wells Fargo, and they're supposed to monitor our balances and make sure that they have set aside collateral enough to cover our cash balances. But what we don't do now is monitor what they're doing and see how successful they are on a daily basis of making sure we're covered. So that's one thing that we have not made any progress in on our end. We want to maintain responsible and efficient banking relationships. And we always want to lower costs by looking at RFPs for banking services, merchant card services, and other services. We have not made any progress there over the last year. We've had the same main banking relationship for many years. I have no major complaints about them, but that doesn't mean there isn't another banking institution out there who could do the same thing for less. So that's one of these things that I'm hoping we'll find some time to do once we get the new assistant finance director on board. We want to reduce the number of bank accounts. I think in a later slide, I have the number of bank accounts. I think it was 25 to 30 that we have. Most of those are because of the debt issues that we've done in the past. And those are, some of those, when I came on board, we really didn't need. We just had to empty them, transfer the money somewhere else, and shut the bank, close the bank account out, which we have done to whichever ones we can. So that benchmark has been met. Next slide. This is our office operations, which is, like I said, not only maintaining the operations of our office and paying our bills, but running accounts payable and payroll. We want to improve the efficiency of those processes. We need updated and financial policies and procedures, and we need manuals, and we need to get these things written down. We haven't made a lot of headway there. The people that do the processes know the processes, but if something were to happen to them, we'd have to retrain somebody from scratch because there's no thorough and updated manuals. The Munis system has some processing manuals they can use, but there are always things that we have to do specially. Like if you run into this problem, what are you supposed to do? Who are you supposed to talk to? Who are you supposed to ask? Those things need to be documented. We want to maintain accurate and timely payroll processes of reporting. Our benchmark here was to reduce the number of supplemental payrolls, adjustments, and reissues. I believe we have made a lot of progress on that since I've been here. When I first started, we were having supplemental payrolls every pay period, 2 or 3 supplemental payrolls of pay period for somebody that forgot to post hours for someone, a new employee that didn't get added. We've managed to have, with the help of the departments in HR, reduce those. And we want to increase office efficiency by decreasing transactions, using paperless systems, and implementing automation of payments. We are working on that. IT assistance is needed, and they are slowly progressing on that, but they've got a lot of other priorities over there, and we want to move to an ACH payment system for all our vendors, which will reduce a lot of cost for paper, supplies, postage. Next slide. This is our debt management, also a critical role. We have to manage the debt efficiently. One of the objectives then was to minimize the amounts borrowed and ensure effective rates. I believe we've met both of these. We are now doing what I like to call just-in-time borrowing, when we're only borrowing what we plan to spend in the next year, based on cash flow projections from DPW on the capital projects. And we always use competitive bidding to make sure we're getting the best deal from those that are going to buy our debt. We needed to do more timely reimbursement to ourselves for capital expenditures by doing quarterly drawdowns from the debt proceeds. And we've been doing that quarterly. It's not always 30 days from the end of the quarter. And with staffing difficulties and having the person that that's doing this now out on leave. We've got behind for a bit, but I think we're caught up now. So we can go to the next slide because I think I've been addressing the progress as we go. On the grants accounting, we want to make sure we have accurate and timely reporting of grants activity and standardize our grants management. One of the comments that's come back from some of the departments is that, we don't really have documented how they're supposed to run their paperwork through our department when they're applying for grants, when they have an award. And those are the things that we need to get written down in policies and procedures. I would also like to implement quarterly reviews of grant activity and feedback to the departments if we have questions on the grants reporting. And this one we have not had much progress on. We have no staff and we don't have documented policies. I wanted to do some training, some citywide training, not only on our policies, but also with some grant specialists so we could talk to departments about some of the things they may be committing themselves to with federal and state rules that they're not really focusing on when they're applying for the grants. We get grant agreements. There are pages and pages of all these special requirements that they have to comply with. And it's a difficult thing to try to understand all of these different requirements that they're referring to. Next slide. I have a risk management division. As you know, this is Corey. Our goal here is to increase the safety of the city work environments through inspections and safety training in each department, and to conduct quarterly evaluations of department progress in reducing risk and occurrences. Corey does visit the workplaces and help them with inspections. Now, we just haven't got this in a documented form as far as how often they're doing it, what are the results, and documentation of making corrections as necessary. As you know, Corey has been a critical role, has played a critical role in this last year with the pandemic. He has had to switch his safety hat from, looking for slip and fall and other ways that the workforce could be injured to. How do we keep them safe from COVID? And he's been instrumental in helping get those city workplaces set up and cleaned and disinfected, that kind of thing on a regular basis. So next slide. Here we've given you the table that's in the budget book. Tried to make it big enough for my eyes to see so you could follow it there. Stretched it out. And this to show you the progress. I don't know, we'll go through some of the reasons for the changes here and the increases and decreases. To note, on the bottom there is a projected savings in 21 of $164,800 due to our vacancies that we've had during the year and good stewardship of our budget. Next slide. We can always come back to this if you have more questions on it. This slide here talks about some of the detailed changes from 21 to 22. There's an increase in salary and benefits. The biggest, besides the COLA, and I have more than half, a good amount of my employees are going to get a step next year. So we have a significant number of people getting steps, and we have the COLA that's coming up. And the assistant finance director is an A18 compared to the position that we're leaving vacant, which is an A7. And there's a difference in net effect on salary and benefits of about $80,000. So that's part of the reason for it, that you see it jump more than you would expect. We have a decrease in supplies and other from 86.2 to 63. We try to look at our supplies budget really carefully. We're actually spending less than we have budgeted, so we trimmed that down to conform with our budget constraints, and we cut the training budget in half. I'm not sure how that training budget's going to work. If things open up and I can start getting people into training, I'm going to want to do that. But it may be that when I go to training, I'll have to foot the bill myself or something just to make things work through the next year and get this money. allocated to the staff people that are really in need of some training. Increase in the capital outlay. We had replaced some chairs. I think it was FY20. We had replaced some chairs, and nothing in 21. But we want to replace the remaining old chairs that we have here. When I first came in, we had a lot of people that are having back issues and stuff with their chairs, and we sit a good portion of the day. We're not we don't have the kind of work where you get up and walk around a significant amount. So we do have some health issues that we're trying to address with the chairs, and we weren't able to replace them all because we had limited funds and we had to replace our folder and our inserter machine. And we hadn't planned on that, so we had to use some of those other funds for that. We have an increase in contract services. Most of that there is because of we're buying some more OpenGov time. As you know, they've got some hours, premium hours they can give us, which is really helpful to us. It helped Katie so much on the budget book this year, having them help her develop that. It's the only reason we were able to manage it with their assistance. So we're going to do that again. And we've got some funding in there for a new copier lease. We don't really know what that's going to cost yet because we haven't gotten it priced out. But our copier is on its last leg. It is heavily used. It's old. We've had all kinds of problems with it, and we have maintenance calls on it a couple times a month, and some of them are significant, like not being able to do two-sided scanning or two-sided copying because it keeps jamming up, and that cost us paper because everything has to be done one-sided. We are having a little bit of increase in overtime. I need to increase that because we have staff working overtime. And some of that overtime is because we've had vacancies, but sometimes that overtime is because we just have a lot of processing to do and we've got to keep caught up on it. So we're increasing that. Our projection for 21 is 14,000. But again, some of that's due to vacancies. So providing we can keep our vacancies filled, we've moved it to $10,000 in the 22 budget. Next slide. Okay, so the typing here is just what's in the budget book. It's very difficult to read because, like I said, we just prepared this just a couple minutes ago. So you can look through that at your leisure, but this is the table from the budget book. And I didn't know if anybody would have questions about the non-allocated budget, the debt service amounts, the community grants are in there. Those are basically at the same amount, and we've moved the $80,000 for the Hackett inspection somewhere else, and we moved a grant for the Department of Social Services for the county somewhere else. So that number overall changes, but the same amount has been allocated for community grants. We have contributions to the OPEB fund in here. As you know, retirees get some benefits on employer paid health care after they retire. And this is where we make the general fund allocation for retirees. We have contributions here to the self-insurance fund. That is determined by what the actuary tells us we need to put into the reserve for the next fiscal year in order to keep up with the claims that are outstanding or in process or that they know about, plus a reserve for unknown, unreported claims. We have the contingency is here. Again, we've asked for $410,000 for the contingency. And I'll stop here and ask Katie. Katie, have we drawn from contingency this year so far?
I believe so. I can get that for you.
Yeah, I'll move on, but when you have it, chime in. We have all of our interfund transfers booked in this division for the capital projects, PAYGO funding. I'm sorry, it's for the from the capital reserve fund. The fleet replacement fund transfer is here. I'm trying to think of what that's. I'm going to have to come back to that. I thought, no, that's replacement. So this is for replacement for every vehicle that is in the general fund operations and departments. The budgets within the departments have the vehicle repair and maintenance amount. This is the amount for replacement of those vehicles eventually. We have transferred to the Housing Assistance Trust. These two transfers that you see here for that and AIPPC represent the amounts that were, I know we had legislation at the state level. I haven't been tracking that to see if it was passed to have some of our occupancy tax allocated for housing assistance and arts and public places. And we put these transfers in the budget as an estimate of that 3% amount. As the occupancy tax first comes into the general fund, and then we would transfer it to these funds for spending.
Jody, can I interrupt on? We also have in the code, I think it's in Title VI, I haven't looked for a while, an automatic tap on the general fund for arts and public places. I'm assuming because we now have the state action for arts and public places, we're not doing the tap, which is 0.005% of the general fund or whatever that amount.
So what we had, I don't know what that percentage would be. I think the 40,000 that we had been giving to AIPPC exceeded that. So this 67,500 will displace that $40,000.
Should we put in an amendment to the code to take
that? I don't know. Depending on how it reads, we might want to talk to the Office of Law about whether or not that needs to be updated, or if it's a general statement about how much we have to give. This does meet that requirement. So I don't know if a change is needed in the wording or not.
Yeah, the tap is up to some small percentage of the general fund. I don't know that we've in recent years ever given the full amount. In fact, some years we only gave 20,000. I think recently we have been giving 40, but I'm assuming if we now have the state imposed tap, we should probably take it out of our code, but we can talk to Office of Law about that.
Katie was going to tell us what's been used from the contingency fund.
Yes. So the first transfer we made out of the contingency fund was for the Office of Community Cares, which we knew was going to come from amendment at the end of budget last year. Election costs and the HACA work group study. So after all of those revisions, we have $388,200 remains in the contingency account.
All right. Thank you. Thank you.
And if that's not used, it falls to fund balance?
Correct.
Thank you.
It's a set aside appropriations. And what we do is when there's another need somewhere, we move the appropriation to the department that needs to spend it. And so as you finished your budget process last year, we had the amendments for what we're now calling community services. We moved that funding out of contingency over into the city manager's office where it's being run right now. That was
Director Dickinson, I have a question on this slide. As Ross also mentioned, there is a transfer of $67,500 to the Housing Assistance Trust, but that it shouldn't have gone to the Housing Assistance Trust. As the state legislation names, it should have went to the Housing Affordability Trust Fund, which we have not yet created the language for. So would that money go to contingency until
what I would do is I would change, there was some discussion about changing the name of that fund. So if the council decides to change the name of this fund to a new or a different purpose, you may do that. If you set up a separate fund, and the state legislation would have named a fund that we don't currently have. So we have to somehow create a fund with that name, whether it's this money. There's a balance left in that fund, which we are using for housing assistance purposes. So if the council and planning and zoning wants to use that same fund, rename it, we can leave it like this. If we want to create another fund, we would take this transfer and move it to the new fund.
Yeah, I believe it was the desire of the state reps and those involved that it be put in a separate fund, the Housing Affordability Trust Fund. It would do separate things than the Homeownership Assistance Trust Fund. And I talked to Teresa this weekend about that and not interfering with what she had already been going on with the Homeownership Assistance Trust Fund. Mm-hmm. So once we create the fund, you'll just move the money over then.
Correct. So having this description of a housing assistance trust transfer there, I don't think it would require any kind of budget amendment because the budget amount that you see in the bill is $3,624,000, which is the total transfers. And if we set up a separate fund, we would just create that and transfer it to that instead. This is just for your notation. This is for our notations to you to tell us where we were going to send it.
Thank you so much.
And the only thing that we might want to impact there is if we have a new fund, we probably have to go back to the Housing Assistance Trust Fund and reduce their appropriations for 22 by the 67.5 because we would have put that in that fund. But that can follow the budget action for the main budget ordinance. Or we could do an amendment.
Would that amendment to create the trust fund be included in the budget, or is that separate council action?
You're going to have to do it separately. If it can be added, you probably want to do it separately and discuss the purposes of the fund and that kind of thing. And the budget ordinance is not really a place for all those restrictions on what the funds can be used for, what the funds have to, if you're going to allocate it to certain purposes, those should be described in a separate ordinance.
Awesome. Thank you again.
That would be my opinion. It's so different than what the budget ordinance is attempting to do. Okay, so continuing down through here, we have other transfers that includes several miscellaneous things. Our Viva CHOP allocation, when we end the calendar year, our employees are limited as to how much leave they can carry over. And anything beyond that leave, if you have a Viva account, we take that excess leave and pay it into their individual Viva accounts. And so this is where we appropriate some monies for that. We have ambulance transport fees here, the traffic signal fees, and a small amount for judgments and settlements and unemployment insurance, which gets charged to here. And then here's where we put the grant for the HACA, for the housing inspections, down in this line item. Okay, next slide.
And Jody, can I ask a question about OPEB?
Yes.
Why would that go down? Isn't that a fixed amount? So we reduced some of it last year. OPEB had the OPEB fund had a little excess in there. I won't call it excess. It's just that our payments we had enough in there that last year when we were trying to trim down our budget at budget time, we took a little bit out of there. I don't know if you remember that slide with the bullets of all the cuts we did at the final part of our budget preparation. And one of them was a cut to the OPEB transfer. Thank you. I remember that now. You're right.
Yeah. So we've put it back up there, as you can see, to the FY20 level, and hoping we can carry that through and make sure that's adequately funded.
Mr. Chair, I don't think you can see my hand, so
I can't.
I'm calling out.
Jump in.
Quick question. I'm looking at the community grants line item. Jody, Ms. Dickinson, I'm sorry. Did I just understand you to say that the difference in between 21 and 22 proposed is the elimination of that 80,000 for HACA inspection?
Yeah, 80,000, and then there was a. No, I don't think we put it in the budget last year. I think that the amount that we were going to give to the Department of Social Services that was in there in the previous years, it wasn't budgeted for last year. So that really didn't impact the variance. I'm sorry, I I don't think I explained that correctly. The 80,000 is the main difference here.
Okay, well,
go ahead.
I was going to ask about social services, but I just assumed that the difference of this 80,000 was HACA. We have not traditionally funded the Department of Social Services. Last year, there was a request from someone in the city that they apply. Their application came in May, if my memory serves me correctly. And that is one department like education and the health department that are county functions and who have larger budgets than we do. So we're paying them twice because they're getting tax dollars for county services. So anyway, but I'm not seeing that that's, I know that 20,000 is in the mayor's budget, but we should be very clear that that has not been an ongoing expense of the city. It came in last year and very late in the process because someone made a request of them. But we have other funds in our budget that address our homeless issue.
So Alderwoman Finlayson, it's my understanding that except for FY21, we have provided that 20,000 to the health department in the previous years. And I can go back and check that for sure because Nikki Pletzer was handling those, and I can go back and look at the grants, but I thought that was in there in the previous years, in and among what was listed in the community grants. But we can go back and look at that. And I know you've been dealing with it longer than I have, but I thought that was a regular thing, and it was my understanding. And I guess the assistant city manager would probably know this is for just an extra team of people to focus on certain needs of the city, certain particular needs for the homeless population. And it gives us a little extra coverage in the city that we thought we needed, which is why it got set up in the first place.
And I understand that. And things seem to be evolving. And please do check, because I've done, like you said, these community grants for many years. And maybe that line item was somewhere else in the mayor's budget. But I'm almost positive it wasn't in community grants. But please check it out for me. I'd appreciate it. And I would also like to know what their budget is for that department, because I know last year when we were having this discussion, they were getting considerable CARES funding. And our funding, you know, many have complained about the funding that we got of CARES money last spring versus what the county was able to maintain. So anyway, I'd be interested in knowing what their budget is also, so that we can truly see the impact that we're receiving.
Okay.
So, thank you.
Can I move on? I can only see a couple people here, so.
I'm good. Thank you.
All right. Next slide. We just have a couple slides here with the other funds. We wanted to show you finances and control of the self-insurance fund transactions. So that's a separate fund within our control. This is where we pay workers' comp, general liability claims, any kind of auto claim that we have gets paid out of here. And it's funded based on the actuarial requirement. Next slide. This is also the health insurance. We are responsible for managing that fund. It's where we pay for the health care costs for employees and initially retirees. And if you notice that what you see on the actual column is a lot less than what you see in the budget column. And there's a reason for that. When we set the budget up, we have to set the budget high enough to cover both retiree and employee claims. We make the initial payments to the vendors out of here. And then at the end of the year, we adjust the actual numbers and take the actual retiree expenses and move them over to the OPEB fund, where we're accounting for all retiree healthcare activity. But the OPEB fund is a non-budgeted fund. So we're budgeting the expenses here. So we set a budget for all expenses, and those actual columns will always be significantly lower because of the transfer of the retiree monies out of here. But in order to pay a vendor, I need an appropriation, and we want to pay the vendors out of here first. And then our vendor tells us, here's what was related to the retirees and here's what was related to the employees. And then we move those expenses.
Mr. Chair,
Of course.
may I?
Please.
Thank you, Ms. Dickinson. Can we go back to the self-insurance fund? Am I reading this correctly that the self-insurance fund is...
Can you back up one slide, please? Thank you.
I'm looking at the revenue less expenses, and it appears that we run a deficit each year in the self-insurance fund?
So we have a very significant fund balance in the self-insurance fund because we're trying to set aside money ahead of time for claims, and they never get paid out as fast as they are estimated to be paid out. So on a year-over-year basis, it always looks like we're putting in less money than we're spending, but there is a significant fund balance there that we utilize. In 21, if you look at the 21 projected column, as you know, we had a big payout during the fiscal year for the HACA settlement, and that came out of the 21 budget there. And so those expenses reflect that expense.
So where does the fund balance show up?
In these slides, fund balance does not appear as a revenue, but when you look at that schedule that's in the front of the budget book that shows the beginning fund balances, it has 21 activity revenues and expenses, and it shows you the fund balance for 21, and then it gives you the column for 22's revenue and expenses. You see what the fund balance is and how it's contributing to the expenses.
Page 20 of your budget book.
Thank you, Katie. Page 20. It's one that we refer to a lot when we're looking at fund balance and the adequacy of fund balances.
Okay, I'll find it. Thank you.
Mm-hmm. Next, can we go back? If there's no question on health insurance either, we'll move forward 2 slides. This is the sprinkler assistance. This is the loan fund. We do have 4, I think, loans out right now. And the money you see coming in is the payments on the loans. And then we appropriate what balance we have in there so that we could lend additional monies if somebody applies for one and they are successful in their application. Next
Mr.
slide.
Chair.
Please.
Thank you. I noticed that this has a minus $332,000 balance. Kind of got my attention when I went over that.
Yeah, so this is because if you look at that fund balance in this fund, there's a lot of monies that have been in there from past years and accumulated based on the original allocation plus the monies from loans in the past that have come in. So every year, as we set the budget for this fund, we set the expense budget high enough that they could spend down the fund balance if they wanted to. If we had a lot of applications and we wanted to make a lot of loans, we could do that. But the funding source for most of this is fund balance. And again, I'll refer you to that table in the front of the budget book that shows which funds are tapping from fund balance. There's also another table that Alderman Arnett had us do last year that shows a table where it shows the revenue sources coming out of fund balances. So it has use of fund balance showing as a source of funding.
Can you tell us?
I mean, am I correct?
I'm sorry, what?
I said we're in the hole.
No, we're not in the hole. This is just money's coming in from the existing loans and spending authority we're providing for the year because there is 332,000 at least fund balance in the sprinkler fund that could be used for loans. That's what we set it aside for. So we want to be able to appropriate it so we can spend it. You have an account balance there that's unused. So Katie, what's the page number of the table that shows fund balance as a funding source?
I think you're referring to page 15 and 16.
Page, I'm sorry?
15 and 16. Let me see, make sure it's what I'm referring to.
Fred, I was kind of asking the same question
Yeah,
on
absolutely.
health insurance.
So I will refer you to 15 and 16, but also look at 17. 17 was the table that Alderman Arnett suggested that shows the use of available fund balance alongside revenues so that you can see here's the total revenues and planned use of fund balance showing your sources, and then your expenditures that show your uses. And in those cases, you can see the funds that have money in them that we are setting the appropriations necessary to spend those if we need to.
I have to say, to my layman's eyes, it looks a whole lot better on page 17.
Okay, yeah, so, and I think that it's just the way when we're in the munis system, we don't budget a fund balance as a revenue source. So these munis tables are not going to show you that piece.
Nope, I get it. Thank you.
Okay, all right.
This is also another place where this table comes out of OpenGov too. So a little hard to see the true story.
Okay. Thank you, Katie. Next slide. So in our budget, we have some contract services and accounting services. And I just gave you all these bullets here that give you the variety of services that we pay for out of our budget. So you'll know it's a not a small number, but we have a lot of different things we do, as you can see. Delinquent account collection. We talked, the bond counsel is being paid out of my budget. Mike Lyles, the city attorney, actually manages the contract, but as of right now, I'm still paying when they invoice us, I pay it out of mine, typically because that's a part of my bond sale and it's a bond issuance cost, and all the bond transactions I record in my finance non-allocated. And so we've historically put the bond counsel payments through my budget. We do arbitrage compliance. We have a firm that does that calculation for us regularly. Armored transport, the auditor's fee is on there. That's a significant amount. The audit committee funds are in my budget. Bank fees, actuarial fees, OpenGov, software payments, the fraud hotline, that's also an audit committee function. GFOA, fees for submitting our CAFR for review every year, shredding, mailing services, payroll, the copier lease, postage and shipping, telephones, postage and inserter machines, also, and the copier service payments. Next slide. To say a little bit about our 21 accomplishments, we've had quite a year here. I have to give accolades to my staff. They kept showing up for work. Some work from home, but each day we'd have a good amount of people in here. The billings and collection side, they were here almost every day throughout the whole year. And the accounting staff, I'd say we'd have about half of the people here on a daily basis. They just kept showing up and doing their work from home. And it's been our year, a lot of our work and our accomplishments around the pandemic and what we've had to do to respond to that. As you know, we had an increased number of phone calls that had to be managed here regarding payments. We had to implement the state moratorium for the utility shutoffs, which, you know, when you have a scheduled billing process and a scheduled delinquent process, and you have to kind of put that on hold. We have system changes that have to be made. We have to send out flyers with our mailers so that they understand how we're treating that. And for a staff of total of 5 people, two of them are billing clerks, and it's just a lot of extra work. And then once the moratorium was lifted, we implemented this water bill relief program using the CARES money, which then again put another wrinkle in the the timing of things and getting payments for delinquent accounts. And with a small crew like that, it's a lot to manage for them. And then we've had to add several additional payroll codes and accounts related to the cost accumulation for the CARES funding, for payroll when we were doing overtime and when people were out sick with COVID or had to be on, what do you call it when you have to stay home? You know, we're on your 10-day, anyways, I can't think of the term, but your 10-day stay home period, we have people quarantine. Yeah, sometimes it's called quarantine. Sometimes they call it, there's something else they call it, depending on what it is. But we had a code that we had to set up for everybody that was using that. Thank you, Mike. Next slide. These are non-pandemic related items. We borrowed our third and final tranche of our equipment capital lease. We established a line of credit for capital projects because we didn't want to borrow and keep the cash on hand. So we have a line of credit out there that we're using as needed. And again, all of this was done through competitive bidding. We maintained our current bond ratings. A couple of the rating agencies had to do surveillance reviews for us, and we were able to maintain our bond ratings and our outlooks. We worked with planning and zoning and MIT to implement host compliance, which is a short-term rental tracking system, both for the permitting side to make sure that everybody who's out there advertising their rooms are getting permitted as needed, and to ensure that those permittees are paying their occupancy taxes. We've just gotten it up and running. We've gotten a few minor collections from it. So, and most of those have been on the permitting side. So it's not fully functional yet, but it is out there. And I haven't had a chance to go in and take a look and see how it's doing and talk about how my staff can use it for occupancy tax tracking. Because right now we have our own manual process that we're working with. The finance budget staff and MIT worked on the further implementation of OpenGov, which we've talked about. Next slide. We, over the year, again, this is pandemic related, the staff worked to analyze and revise the city budget so that we could stay in line with our declining revenues. Budget reports were disseminated and reviewed with management, council, auditors, and the rating agencies. Because, of course, you know, when the rating agencies were doing their surveillance review, they had a lot of questions about how we were handling our revenue shortfall. The risk management administrator was playing a critical role in the safety of its city employees to ensure that their workplaces were safe from the spread of COVID. And we, in the accounting side, issued the comprehensive annual financial report. We have a clean audit opinion. And the report for FY20 highlighted a strong 2020, even with the pressures on the revenues in the fourth quarter. Next slide. All right, so when there's a message that I'm trying to send here to tell you everything that the city does touches finance in some way, everything. When we start something like a program to reach out to do something, or a new fund or a new source of revenue, or we want to reach an agreement with an organization to lease something, either we're leasing or they're leasing from us, it adds something to finance, and it touches us in some way and puts another like think of it like tendrils. It has a tendril of responsibility that reaches into finance, and we have to set up a system to track it. And this is going to the thought that we, as I've said before, we don't have enough staff and enough staff at the levels and higher levels to be able to manage this kind of work. The city I see it staffed like a municipality, a small, quaint, historical municipality, and we are functioning like a complex, large city or county. We are doing almost everything the county's doing. It's a smaller size, but you still have to have that level of expertise and the system set up. Even if you have a tenth of the activity that the county has, you still have to set up a process to track them. And what I did here was try to list everything that we have here, that we do, that we track, that affects us. And I won't try to go through them now, but when we get into things like PPP for the Hillman Garage, that requires an enormous amount of my time. And when we analyze that final agreement, there's a lot of very complex accounting decisions that have to be made with that. And we are going to have to track it through the years that we have that agreement. And so those are some of the most complex accounting that exist in governments today. And we touch on all of them. And you see in here, we have the sprinkler tax credits, we have historical preservation tax credits, we have sprinkler loans. I mean, all of these things are nice and they're good for the citizens in the community. But they add a layer of work to our plates that I'm concerned that we don't have the level of expertise here that we need to manage all this. And it can't be it can't be on one person. Now, I have an assistant finance director hired who's coming on at the end of June. And hopefully I can take some of my tasks and offload the daily operational stuff there that'll help with this situation. But I'm still concerned that we don't have what we need to do all that we're doing. We have, if you just glance through here, we have pensions that we're running. We're running our own pension plan. That's a little unusual for the size of an organization. We run our own payroll. We're using ADP for some of it, but it's not taking a lot of work off our plates. We have a 401A plan. We have 3 choices for 457 plans. We have a VEBA plan. We have to track all the workers' comp issues that come through payroll because they're paid differently if they get an award. So all of those things require a lot of attention. And I will move to the next slide, please. And what I put here is the pressures. We have tasks. What this is doing is straining our staff. We have several staff that are working significant overtime, and only the non-exempt get paid for their overtime. The professional staff get a portion of their overtime as comp time, but they're not able to take it all because of the workload and because it's just, I told you last year how many hours Katie worked on the budget process. And I think I gave her like 3 weeks of comp time, but that wasn't even half of what she worked. So she worked several weeks of overtime with no compensation. And it's going to, and part of these overtime costs, as you saw earlier, are increasing due to our workload and our vacancies. And again, we talked the other day, I'm glad this came up because we don't have adequate office workspace and it's impacting our productivity over here. When people are in the office, any conversation is disruptive because most of the people sit in cubicles. So what's happened over the years, and I know you've seen it over the years, and it's still happening now, it's had staff burnout and turnover. We've had critical people leave this office because of the relentless workload that's presented to them. And we have a lot of important finance roles that are not being conducted because we don't have enough properly experienced staff. And there are many opportunities here for us to coach and train the staff we have. But when you do that, you have to if I'm going to coach somebody on, here's what you need to understand about what we're doing and all these things that you saw on that previous slide, I've got to have time on my slot to sit with them for days and talk to them about all these issues and everything we have to set up and manage. So as of right now, because I have an assistant finance director coming in, and I think that's going to change some of this. I'm not proposing anything now. I want to see how that works out and how the workload division gets changed. But I think that in the near future, I'm going to propose some kind of reorganization of finance. And I've already talked earlier about the office space we need. And then some additional staff roles at the upper levels that I feel are critical to fill some voids that we have here. And also we need time to coach and train our existing staff to do things more efficiently. So next slide.
So, Director, this staff space, the additional office space, and City Attorney Lyles brought it up as well.
Right.
You know, I don't know how we address that. I mean, I understand it. I feel cramped in the quarters that are allocated to the city council as well, and particularly since we have one computer for the 8 of us and they all sit at my seat when they need to use it. But I understand it is a problem, but I don't know, is anyone being directed to think about a solution to this problem?
Well, I know I have discussed it in the last few months a couple of times with my boss, the city manager. It's tough to think about how to do it. And when the Office of Law was talking about the other day, you know, there's solutions that occurred to me, but it would mean getting space somewhere else. And I don't know what that means. If they wanted, he was discussing the need to get more space. And I feel like this building is set up for finance because we have a payment window and we have a vault. And those are investments that have been put into this building and would, you know, be more costly to try to put it in somewhere else. So, you know, if they moved, we could move there. I mean, that's just my concept of what could happen. It's not necessarily the best solution, but we'll just have to see if something comes of this. And no, I don't think anything formally has happened yet. I mean, we've had a very challenging year this year with the budget. So it's one of those things that's really tough to look at this time. But I feel it's definitely impacting my staff and their efficiency. I've got 14 people in cubicles.
So I know we're designing Hillman Garage so that if we don't have down the road a need for all of the parking, it could be converted. And maybe but that's like a solution that's 10 years, who knows how many years down the road. I guess I raise it because you and Mr. Lyles have raised it, and I guess it is a question to go to the city manager. We also we share with you the feelings of crampedness, but I guess other than recognize it and recognize the impacts of it, I don't have a sense that we are working on a plan.
Alderman Arnett, if I had my hand raised too.
Okay, I couldn't see you. I'm sorry.
Okay, thank you. Yeah. So you're right. I mean, Director Dickinson said what I was going to say, and that's, you know, since I've been in this position for, I guess, 14 months now, we've been in budget crisis that entire time. So we haven't actively looked at it. But I can tell you that, you know, and I think I mentioned this the other day when the city attorney was discussing this as well, that it's pretty cramped in 145 Gorman as well. There's no space to add any additional staff there. And I know some of them are in closet-sized offices. I think the answer is to just do a sort of a scan of the availability of offices for rent here in the city to see what's available and what the cost is. I think to try and build something new would be a very long process and would be very expensive as well. But I do think that we need to at least do sort of a survey of the city to see what might be available and what the cost might be. And
there seems to be a lot of vacant space around too. I don't know from looking at things from the outside, when you see a sign, you don't know how big it is on the inside or what it looks like. So just, that's something I've noted too, that there's some vacancy signs around some of these business buildings.
So I guess my comfort level would be that, and I would think it would be you, Mr. Gerald, that somebody has got this as a task to look at, probably sooner rather than later. Mr. Lyles has a request in for another attorney, and I think that there are other issues, particularly issues like expanding affordable housing in the city with an expanding population. There's going to be a lot of new things on the horizon. And by the way, we're not over the COVID, and if the way things are going in India and Brazil, we may not be over that. So some of our existing problems won't go away necessarily.
Mr. Chair, may I ask
Certainly.
a question? City Manager Gerald, what's the status of the new Public Works facility? What's the timeline for it coming online?
So the most recent information that I have is that the design is wrapping up the design process, and they're going to see it has a design build, so we don't have to advertise the construction part. So they just will need to order materials and get those in. I think that the construction is scheduled to start this fall. And that will be about a 9 to 12 months construction project. So it will, probably the summer to fall of 2022, that will be available for use.
Okay. I'm sure you know what I was thinking about, being able to use existing DPW space, since everyone will be moving into the new facility, but that's down the road.
Yeah, and that space is really inadequate. You're talking about the space out on Spa Road.
No, I was talking about Gorman Street.
Oh, yeah. So the office staff is not moving. It's all the functions that were at Spa Road plus utilities, which has been on Chinkopin Round Road for a few years now. They're moving in. The public works staff stays in 145 Gorman.
Oh, okay. Well, that may be another consideration. My next question takes us back to slide number 22. Ms. Dickinson, are there any tasks listed here that you could empower other directors to do? And I'm the last one to put more work on an already full plate, so it may not be doable. But are there some of these things that you could empower others to do? And I'm talking about director level.
So first I'll ask Julian to move the slide back to the previous slide.
It's the list with all of it's on, I can see it.
Yeah, we just moved it back. So
Yeah.
the answer to your question is no, not at the director level. Everything you see here, there's a tracking mechanism because we have to account for it. And we have to get the accounting transactions related to, for instance, general billings. That's our module in Munis that creates an invoice for anything that's not utility or capital facility assessment related. There's leases, the pilots, all kinds of arrangements that people paying us on a regular basis go into the general billing module. And the reason that's on there is because we have to send an invoice, and then that gets posted, and they can pay online because it's a part of our regular billing system. They can go pay online and find it online and pay it online. So it's an automated process. All of these are here because they have accounting impact. Like, for instance, when I list the 401A plan, HR is in charge of that. They're in charge of the 457 plans. But my point here is that every time we run a payroll, the payroll system creates the withholdings or the contributions for all these, and we have to make sure they get sent. In addition, they can require either extra accounting, like the health care and dependent care accounts have a separate cash account set up at a bank that's like a replenishing account. We replenish the account and they take money out on the other side. So, those things are HR related functions that, again, when we establish them, touch finance and require us to track them. And sprinkler, the historical preservation tax credits. Those are ones that we do once a year. We figure out who's going to get a tax credit. There's a cap on the total. And so when we send the county the list of who gets the tax credit this year, we have to go through the list to make sure we do first applicants first and up to the amount of the cap, and then track the people that are delayed. And planning and zoning does help us with that by telling us who's eligible and giving us the new people that can have the tax credit. But there's a tracking system that has to move forward from year to year to year. And there's no other place to do it but in the finance office, where we are sending these things to the county as to who gets the tax credits.
I guess I'm looking at a wholesale reorganization, and you had that as one of your solutions.
I already have some ideas on where I think things are lacking, but I think until we get the assistant in here, and I'm able to split my workload and do a little bit more coaching and seeing what the staff are doing on their desks to see if I can find efficiencies, and then I'll be able to see where else we need expertise. Just know that in other governments, they have more people handling these types of things, and they have higher level accountants doing them and managing them on a day-to-day basis.
I'm sure I don't have to tell you that I am a proponent of your work and all the department's work. But I hear my colleagues
Fred, I see you.
Pardon me?
I was telling Fred he's had his hand up for the longest time. I was
okay.
worried it would go numb on him, so I just said I see you.
Mine went numb. That's why I used my electronic hand. So use your electronic hand. It saves you. Anyway, I just think that with some of my colleagues talking about reducing staff and reducing government and services, we're going to have to think out of the box on how we can maybe give up a little of our territory and get some help from others. But again, that's part of the big reorg.
Right, but one of the options is for some of these things to get help through outside contractors, which is possible. But these are ongoing tasks, so that has to be a regular. If you're going to use people from the outside, you have to find the people that can help you, and then you have to keep them here on a regular basis. So that's an option too, to try to find opportunities where somebody on the outside can help.
But we do have to pay for them.
Yes, we still have to pay for them, and they're not cheap. They, hour per hour cost more than an employee.
Okay. All right. Thank you.
Alderman Payon. You're on mute. Mute.
Thank you, Mr. Chair. I have a couple of questions about, in reviewing the line item matters for the finance department. They don't involve a huge amount of money, and I won't take very long, I don't believe. The pay raise that is indicated is about $250,000 or thereabouts. 13.3% salary raise. We're just now hiring a assistant finance director. I mean, 13.3% in 1 year is, well, I didn't often get that much, that's for sure.
So Alderman Payon, earlier I spoke of what's causing that. And I'm leaving one of my lower level accounting associate positions open, but I'm hiring an assistant finance director that's at a much higher grade. So that impact is same number of employees, but not filling a lower level one and filling this high one is going to cost at least $80,000 extra in both salary and benefits. So that's a big piece of your increase you're calculating is the new finance director is a higher paid, higher skilled employee. So that's a good chunk of it. And when you go through the numbers again and you look at a 3% COLA, and about 2/3 of my employees are due for a step. So that's every step is 5.35%. So with a 3% COLA and 2/3 of my people getting a 5% raise, that's not quite 8%, maybe 7 something, plus the 80,000 for the assistant finance director. So that's what's causing that big jump.
Are step raises discretionary at all?
No. If you are an employee and you have a satisfactory job performance for the year and you're due a step, so every year you get a step, but once you get up to the higher steps, you have to wait until you have a certain number of service years here before you can get the step. That's in the upper step. So you don't get one every year, but the newer employees that are lower on the scale get them every year until they get to the higher steps, and then they have to wait till they get their number of years in. So it's periodic at that point.
Okay. My last question had to do with a $39,000 allocation for dues and membership. I got to tell you, that's the highest of any department.
But most of that is one payment, and I'll have Katie tell me what that is. That's
MML.
We pay the MML dues, Maryland Municipal League dues, and that's a chunk. How much is that, Katie?
That's base. Oh, sorry, can you hear me? Yeah, that's basically it. It's like 32 or 35,000 of that 30 million.
What I got.
So there's more that's in there. There's GFOA dues, but the big chunk of that is MML, which is like at least $32,000 to $35,000.
All right. The way it was written, I thought it was within your department. That makes sense because
I wish I could have that many memberships, but we try to keep our memberships at the minimum for GFOA and Maryland GFOA.
Hey, look, that's why it got my attention. Mr. Chair, I have to say, I have to leave for physical therapy in just a few moments. I'm not being rude if you don't see me anymore, but I don't want to interrupt when I leave.
Well, Mr. Snyder is going to be upset that you're not here for his presentation.
I can tell already that he's upset about that. But I can also speak with Mr. Snyder and perhaps get a lot of what I would get if I were here. Thank you.
All right, thank you. Are we ready?
Mr. Chair, I have a question on this slide.
Please.
Jody, where I see listed here, and I asked this last year, and I just want to follow up. Where do we stand with the pilot agreements, and particularly with the county who doesn't pay us a single cent? Where do we stand with that?
So we have pilot agreements with, I'm going to say there's maybe 10 pilot agreements with different organizations. Most of them revolve around lower income housing developments, and they're paying us based on some other factor. And we don't have a pilot with the county. We never have. They have the Arundel Center and the Whitmore parking garage. I don't know if they have any more inside the city limits. And we have never had a pilot arrangement with them. And the only thing that I can tell you is at one point when they do the tax differential every year and they calculate for city residents what the county taxes are going to be, they factor in some of these things that are reflecting the fact that they don't pay us for doing fire service to the Arundel Center, things like that. And it's maybe something as subtle as rounding, when they're doing their calculations, rounding things in our favor, et cetera. Now, I haven't gone to the extent to prove that things are being rounded in our favor or that gets washed out of that tax differential calculation or not. But
So
we have never had one with the county. Of course, we have one with the state. And
Sometimes.
yeah, sometimes. And we've been fighting for that extra money for years. So I'm just waiting for what else is going to happen, because right now it's in there at 750. I'm just waiting to see what happens.
Question then, because I think services are great and all of that stuff, but we provide, services back and forth. They were just saying they have a very good mutual aid agreement.
Right.
And so here is my question, because I can't take another year of them not paying us. Does the council recommend through a resolution to the finance director that we would like you to seek out an agreement with the county and a payment for the services? Or how is that handled? And particularly Whitmore Garage, which was home to historic Black communities that were ravaged, and nothing is there to show for it but a sloppy garage. And we don't get paid for it at all. We don't get anything. So how can we move forward with requesting some sort of payment from them?
So I can't answer your entire question. For those two properties, I don't know if anybody else can help to say if the county has any other facilities besides those two properties that are within the city limits. I don't know what that amount would be, and they're tax exempt, so we're not allowed to do the property taxes on them, and we're tax exempt too. Our properties are tax exempt too, so we're getting some benefit from that. But
I'm not aware of any other facilities. I can tell you we've got some out in the county as well. We've got the water treatment plant, and we've got the that whole park complex out there is within the county. But I'm not aware of any county facilities inside the city other than the two that you mentioned.
And I would doubt we're paying a pilot agreement to the county for having our properties in their county location.
Well, probably because they haven't been paying us since the city's been chartered.
Alderman Gay, if I may, this was developed by John Hammond, who is a city resident, and early on in my career, I really pursued the same line you were doing, and we can do that, but I was advised by him that it's probably not a question we want to ask, because we'll likely find out we owe them more than they owe us. We can do that certainly, and maybe best informally, but I think that we come out ahead on the deal.
How much in total CARES funding did the county give us? Was it just the $4 million?
They gave us, no, they've given us almost $5 million now. They gave us the 4.2, then they gave us 550, and then the health department gave us another 100,000 to continue to pay Laura's team for the community outreach up through the end of the pandemic. So
we have been
they've given us a lot of, we have a really good relationship with them right now.
We've been a good neighbor and partner with them.
Yes.
For all of these years, and all we're worth is $5 million in special CARES funding. I really do, Jody. I'm being serious. I would like for you to, if possible, because I know the budget is stressful, please find out how much that would be, a rough estimate, because even if it is the $750,000 is equivalent to what the state's giving us, we could do something with that. I mean, something's better than nothing.
For those two pieces of property, that I could calculate the tax that we would get on those two pieces of property, but it would be nowhere near $750,000.
It would be something.
So we are 7% of the county population. And obviously these are things that are worth exploring. And maybe that's something that can go on a less formal level between the city manager and the county counterpart. Is that Chris Trombauer now? But
Matthew Powers.
Okay, but earlier information was this is not a question we really want to ask because it's not going to work to our benefit. You may or may not be satisfied with that, and we can pursue it, but we need to be prepared to find out that it's not going to give us the answer we want. I think we're ready finally for Mr.
Okay.
Snyder.
Well, let's, yes, go forward 2 slides, please. Yep, there we go. Brian, are you ready to take over? Sure. Or are you sleeping? He probably slept.
I'm good. Yeah, go to the next slide, please.
Brian, you'll have to talk into your microphone a little better. Sometimes I know you have an odd setup over there.
Yeah, doing the best I can with what I got.
Yeah, I know.
So I'll try and be brief. As I think I said once before, procurement, we buy it, we maintain it, and then we sell it when it's surplus. That's pretty much it. So that covers really the first four bullets that are displayed as the functions. We also monitor MBE use, minority business enterprise usage, and engage in outreach for participation. We also are part of the cooperative purchasing effort through BRICPAC, which is the Baltimore Regional Cooperative Purchasing Committee. I also facilitate real estate transactions by way of, obtaining appraisals and boundary surveys, environmental assessments, etc. But Ms. Leonard does the heavy lifting of pushing it through to a title and all that good stuff. We're also, my department also provides administrative support for citywide electricity use, cell phones, and copiers. We have been successful this year in getting some rebates back from PG&E, as well as collecting some mistakes they've made on billing, which is due to sharp eye provided by Jim Pittman. Go to the next slide, please. So my number one goal coming up would be increase in efficiency of city spending and enhance the participation of minority and business and enterprise firms. So the objective obviously is to increase the participation. Benchmark is completing and implementing the MBE policy and outreach plan. Performance measure is the date of the implementation of the plan. Currently, we're working on updating our records and historical data to establish the baseline measurements. And we went, 15 months without a second person. We're only 3-person staff, so we were 15 months with just 2 of us. So we got bunched up a little bit, but we're getting caught up. The second goal is to improve automated procurement process through our P-card policy. And I'll be working with Jody's staff in updating that policy and implementing it. That was a goal for this year, and it's still on the plate. Go to the next slide, please.
Okay, before I leave, you leave this slide. Just goal 1, I'm so happy to see. And I look forward to working with you and Alderwoman Finlayson and Stephen in the coming week. I think we're meeting sometime next week to help achieve that goal. I look forward to it.
Right, we're lining ourselves up by collecting all the data and setting up ways that we can measure things. Currently, we don't capture minority participation of some contractors on our large construction projects. So, our percentage numbers are way understated than what they really are. I'm hopeful that we are able to contract to to obtain that data through Munis by using the system and the contracts module that was recently implemented. Let's go to the next slide, please. So we're all about salaries and benefits here. You know, that's all our spending. We do have some savings, basically because the senior buyer started in August, so we have a couple months of savings there. You know, previous year we had a whole year's worth of savings. It's probably 100 grand or so. Next slide, please.
Let me interject here that you will see that the budget for last year is actually higher. The previous budget was set at a level higher than what the new person was hired at. And so you'll see that their total salary and benefits budget actually went down slightly. He's saving.
Okay, so our accomplishments this year, we managed, you know, several dozen RFPs and other methods to get city staff, citizens, and businesses critical assistance during the pandemic. Again, we did reach full staffing level when we hired James Mobley. We increased efficiency in the procurement policy, basically MIT's help. We, again, through Munis, we've implemented an automated check request and P-card payment through Munis. What also is up there is we automated change orders. So we're trying to get rid of paper. And the next bullet, we did implement the contracts module as previously mentioned. We're going to have to revisit that and how we're going to use that to make it work for our measurements. We also had the successful procurement and maintenance of PPE levels. Now, I'm not aware of any time that our staff was without proper PPE. I know a couple times we had difficulty buying stuff because we are such a small purchase. You know, the county's buying $3 million worth of masks and we're buying 1,000 masks. So we weren't able to, you know, obtain certain, use certain vendors to get these items, but we were still able to get them. You know, at one point we did reach a critical level for Tyvek gowns for the fire department. And we got those through donations. So I think we got 1,500 gowns through donations. So we're very fortunate there. Same thing with some of the N95 masks. Last thing listed here is the completion of the Hillman Garage and City Dock redevelopment solicitation. You know, that was culminated through a 16-month process. I found out as we engaged somebody to help, we engaged CBRE to help us through the pre-development agreement process and getting the terms that we favorable for us. They said they normally charge 1% of the total process, total project, which would have been $650,000. But since we did the procurement staff part ourselves and already had selected a vendor, we were able to engage them for $300,000. So that's a very large savings for that effort. Next slide. I think we're done. Like next.
Yeah.
Yep.
We're drawing a blank. All right. Are there questions from the committee or other alderpersons? Is anybody hungry yet?
I am hungry, but I do have a comment, not a question. Thank you, Mr. Chair. Mr. Snyder, I just want to thank you because you're the lone man in procurement. I mean, I know you have staff, but you carry most of this. And whenever I've asked for assistance, I mean, you got me the shields and the hand sanitizers, and I don't know how you worked your magic, but you were always able to deliver. So, I say thank you, along with the whole finance department. But I know that you're over there across the street with, just a few people at your disposal. So I just want to say thank you.
Thank you. Thank you, Alderman.
Director Dickinson?
Yeah, I will echo that too. And, this past year, their division purchasing had to do so many new and different things with the contracts and getting the supplies and trying to get them fast and getting good prices. For a while, we were finding people offering us things at prices that were way too high, or they'd be way too low, and they weren't good. They weren't quality supplies. So it was a really hard task to do. And he's looking forward to the next step in his life. So if we have to replace him in the next year, it's going to be a tough thing to do. So just want to give him a good pat on the back too.
Thank you. Speaking of new tasks, I was tasked with giving Brian Paquin a haircut when we were there.
Were you?
Yeah, first 2 or 3 months, we were the only 2 people in 161 Duke, and he was pleading me to give him a haircut, so we made it happen.
Alderwoman Tierney, can you top that?
Do you have a before and after?
No, what I do want to say is that I find it amazing that your budget consists mostly of salary and benefits. What, don't you use any automation or any sort of portal, that kind of costs to do this? I mean, it's just, when you for RFP process and all that, is it just all?
No, we do. So, most everything's electronic now. I mean, they can submit their proposals electronically. We do use the state system to post our bids, eMaryland Marketplace, and that will shoot out an email to certain firms that are under whatever commodity we're looking for or whatever service we're looking for. So they're notified, and we get pinged all the time when we post those bids. We do post it, on our website as well, and we do pay for advertising in the Capitol.
Yeah.
But other modules that we have in Munis, fortunately we own them, and it was just using IT staff to roll it out, and figure out which buttons to switch on and whatever. But it takes time to go through that. But, there's really no other services other than the advertising.
Yeah. Well, I just commend you for your efficiency. It's to be admired. Thank you.
I appreciate it. Thank you.
Mr. Chair, I have a question.
Certainly.
With the surplus of $37,000 that was saved, what did you do with that money? Where does that go?
Went into housing affordability.
Hey, it could. That's why I'm asking.
It'll fall to fund balance at the end of the year.
Yes. Any unspent budget, as Katie just said, any unspent budget amounts fall into fund balance and give us that bit of excess that we typically have at the end of the year.
Is that 2.5?
For us going into 22, we are projecting, I think it's 2.2 million that we put into the other reserves at the end of the year.
So I want to thank Mr. Snyder for putting me on the list of new procurements going out. That's been very informative and helpful. And of course, thank you for all your services over the years. I hope you don't feel like we're kicking you out the door, because we don't want you to go. But I do want to thank you for that and your presentation. And pending any questions, I do want to remind 2 people at the beginning of this meeting that thought it would go quickly and we might end early. as opposed to so far 55 minutes overtime. But I want to thank the finance department, not only for all the great work you've done during the years, but the presentation you gave us. It's informative, but also raised a lot of points, made some points. So we heard that. We understand the pressures that the staff are under, and this year, particularly all the things you were doing with all the new curves thrown at us by COVID. And we do appreciate it. And I at least, and I think others do too, really appreciate the OpenGov. Keeps us busy, keeps us out of your hair because we're busy moving things over to Excel spreadsheets and manipulating them. And I haven't even begun to scratch the surface. Hopefully the reward will be I can answer my own questions rather than asking you. But again, I think from all the council, we thank you for the presentation and more importantly for the work you do. Are there any other comments before I accept and we no longer have Alderman Payon to make a motion for us to adjourn? But are there any other comments in closing?
I will take over the responsibility of Alderman and make a motion that we adjourn.
I will take over the responsibility of seconding that motion. All those in favor of adjourning, please signify by saying aye. Aye. We are adjourned. Thank you, everyone.
All right.